Hello, all of you. Good morning, students. Good morning. Welcome to the class. Am I visible to all? Am I audible to all? Can all of you hear me? Can all of you see me? Just I need a thumbs up. Uh, um, Yes. Okay. So two things, students. We cannot. I'm Dr. Punit Bhojani, the OG Guru, and I'll explain to you everything how the sessions are going to run and how everything. Don't worry. All the notes, सब कुछ आपको everything will be you will be getting in. Absolutely, don't worry at all. First of all, yes. So I can see around 40 students alive, and very good. And let us begin the session. Before that, I would just like to tell everybody that please do not use the chat functionality in the Class Plus app. Okay, yes. Good morning, Chitranjan, Vijaya, Dr. Sangeeta. Is the audio video all clear? Am I visible to all? Am I audible to all? In the Telegram only. Okay, request all of you to please use only Telegram to communicate during the lecture. Is this understood to all of you? Okay, so is the all clear, all good to go? Excellent, Lipsha, Chitranjan, thank you very much. Okay, now please understand, yeah, there was a slight login technicality issue. Now it is all sorted. Okay, so point number one, we are beginning today. Notes also you will be getting it by today, so the answers sunenge first. Before, let me first explain to you the overview, how we are going to conduct the classes and what is the plan for the whole next 10 days. Okay, so point number one, for any FMGE examination, OBGY is a major subject. And as you know, there are two subjects, obstetrics and gynecology. Okay, always we have to learn gynecology first, so that because lot of concepts of gynecology will be covered, lots of concept of obstetrics you will be learning while we are studying gynecology. So the next 5 days, okay, today is Tuesday, Wednesday, Thursday, Friday, Saturday, all the days we have class from 9:30 to 1:30. Okay, of course we'll give you a small break in between. So today we are starting at 9:40, so whatever, till 1:40. Okay, so this is going to be your gynecology classes. Okay, and obstetric will be from next week onwards. Okay, and during the course of the lectures, all the three things will be covered. That means we will be giving you theory concepts. I will be discussing MCQs also little, and also images will be shown to you side by side. Okay, this will go on for total 10 days, matlab 5 days in this month and 5 days in this and all that. And I request all of you to please use only Telegram. I can see 122 members in the Telegram right now. That's excellent. Please use only Telegram to communicate with me during the lecture series. Okay, later on I'll also tell about my YouTube channel and Insta, that all of you can follow me over there also. Now there will be, so during this 10 days classes which we are going to take, the theoretical aspects, MCQs, image based also will be covered. Later on, towards nearing of our exam, somewhere in October, November, we will also be having 2 turns dedicated to only MCQ discussion, like a test and discussion, where again 2 days, so one day all gynec MCQs will be discussed, one day all obstetric MCQs will be discussed. Okay, and trust me students, I am training students since last 20 years. 2003-4 I started my teaching. Last 20 years it is my record. You can ask all your seniors, you can ask all your friends, whatever I teach from that only will come in OBGY. Students came out of the examination hall in Jan FMG, June FMG, and they said that, sir, out of all the 19 subjects, we were most confident in OBGY thanks to you. Means OBGY questions we were able to answer with most ease. And I'm very sure same thing will happen with you when you will master all the class. Okay, don't get too much stressed about the notes. Notes will remain with you lifelong. The point is concepts, because we believe in hashtag crystal clear concepts, because if your concepts are clear, any MCQ in the world you can answer. One liners are becoming less in FMG. clinical case scenario, image-based question, and concept-based questions are increasing. Yes or no? Agree with me if you have given the past FMG exam. So if you know the concepts which I am here to teach you, you will love OBGY, and all of you will become master of OBGY in the next 10-15 days time is my guarantee. Clap if you feel happy. Okay, the last thing before I begin, please feel free to ask questions. Please feel free to answer question. OBGY minimum 30 MCQs we can expect. Minimum 30. Okay, sometimes 28, sometimes 32. 3 years back, my dear students, 3 years back, you can ask your seniors, 42 MCQs came from OBGY. How much? 42. And all my students were jumping in joy, and all of them got 180, 190, 200, because somebody got 40 out of 42, somebody got 41 out of 42, somebody got 42 out of 42. Okay, so is this absolutely crystal clear to all of you? So just sit back, relax, enjoy the class. Please ask questions, and when I put forward an MCQ, please answer the question also. Is this understood? I want you to answer. Right, wrong does not matter. When I say okay, chalo answer ABCD 1 2 3 4, please type in the Telegram group the answers. Okay, anything you don't understand, you can ask me in between. So with this much as the introduction, so I repeat, gynecology, there's a fixed pattern, HPO axis, infertility, everything will be covered. Trust me, nothing more is required other than this. Okay, so with this as the background, let us go on to discuss the first topic in the basics on introduction, which is the infertility we're going to discuss. It's a major topic. Constantly, I will also be telling you which is the weightage कि ये टॉपिक अगर है तो ये मस्ट नो टॉपिक है, ये टॉपिक लेस इंपॉर्टेंट, दिस टॉपिक मोस्ट इंपॉर्टेंट. I will be telling you. So you just sit back, relax, enjoy the class, and trust me, my dear student, these 10 days of my lecture are going to be the most beautiful experience of your life, is my guarantee, and you will remember me lifelong. Okay. I have a habit of cracking jokes. You can put the emoji so that I know you're understanding, laughing, and constantly keep on putting the thumbs up if you're understanding, so that I know we are understanding. Okay, now शुरू करेंगे अभी से. Okay, so first thing, the basis of the HPO axis. HPO is hypothalamo pituitary ovarian axis. Okay, pituitary will send the first signal FSH. Okay, so pituitary is the master, ovary is the servant. Why is it important to understand? Yeah, we will send it back. Okay, yeah. For beta, you just note down some few important points. All the slides which are going to come like this, all the slides, you are going to get it by today evening. Okay, and tomorrow slide also I will send you, so that you can, if you want to take a printout, you can take a printout. Okay, now please pay attention. Okay, pituitary, we call it as the master, and ovary is the servant. Why I tell you like that, you will understand in some time. So pituitary is the master, ovary is the servant. Okay, pituitary से first hormone आता है FSH, and that FSH is follicle stimulating hormone, and that FSH will act on the ovaries, and the ovary के अंदर the follicle starts growing. The follicle starts growing. What size it should reach, and that also is an MCQ, and I will ask you in some time. I will tell you. Okay, so growing, so follicles are growing. Growing follicle is secreting estrogen. So estrogen is also rising. ये आपका फर्स्ट MBBS फिजियोलॉजी का रिवीजन है. Okay, yes, very good, Chitranjan. Okay, so follicles are growing and the estrogen is rising. Only when a particular level of estrogen is reached, that sends a positive feedback to the brain. So this is example of a positive feedback. कि estrogen भी बढ़ रहा है, and pituitary से फिर आ जाएगा another hormone which is the LH. And LH surge, all of us know, is responsible for ovulation. So please understand the sequence of events. क्या हो रहा है, all of you should understand. Anybody? पहला क्या आता है? First comes the FSH. Then the follicle is growing. That will secrete estrogen. Then the rising level of estrogen will cause the LH surge, and LH surge is responsible for ovulation. Very good, all of you. And ovulation के बाद, please understand, only if the female ovulates, after ovulation, that structure gets converted to corpus luteum, and then that is secreting progesterone, and then the progesterone enters into the movie. So progesterone is the second hero और second heroine जिसका एंट्री मूवी में इंटरवल के बाद ही होता है. बात समझ में आ गया? ओके. So progesterone, what does it do? It prepares the endometrium for pregnancy. It converts the proliferative endometrium to secretory endometrium. If the implantation takes place, corpus luteum continues to secrete progesterone. And if the implantation will not take place, the corpus luteum will rupture, progesterone levels will drop down, and the lining comes out in the form of menses. So menses is nothing but the shedding of the endometrium. So every month what the female get the menses is nothing but a progesterone withdrawal bleeding. Is this understood to all of you? Okay, that every month what the progesterone will drop down, the lining cannot support itself, and lining comes out in the form of menses. So if they ask you, okay, give me the simplest example of a progesterone withdrawal bleeding, so the natural menses is nothing but a progesterone withdrawal bleeding. Now very simple rule, मैंने क्या बोला कि sir, only if the ovulation takes place, then the corpus luteum is formed, and then the progesterone enters into the picture. Do you agree with me? Yes. So ovulation, corpus luteum, progesterone. So suppose if I write no word in front of everything, that is also correct. That means, sir, no ovulation, no corpus luteum, no progesterone. Do you agree with me? Yes, sir, if the female will not ovulate, then there will be no progesterone. Yes or no? Thumbs up. Yes. And can anybody tell me another word, modern word or a simple word for no ovulation? नो ओव्यूलेशन मतलब कौन सा है? क्या बोलेंगे उसको? नो ओव्यूलेशन को अनदर वर्ड, एन ओव्यूलेशन. एक्सीलेंट ऑल ऑफ यू, एक्सीलेंट अब्दुल, चित्रंजन, ऑल ऑफ यू. सो कैन यू टेल मी, अभी से अगर आपको मैंने क्वेश्चन पूछा कि इन पेशेंट्स, ओके, फर्स्ट क्वेश्चन फॉर द डे, इन पेशेंट्स who have an ovulation, okay, in patients who have an ovulation, let me first finish the answer, let me first finish the options. Okay, in patients of an ovulation, which hormone is missing or what is absent? Chalo, type in the Instagram, I type in the Telegram chat box. Okay, whenever I say chat box, that is your, very good, excellent. Okay, yes sir, ये सब भी problem हो सकता है. I'm not this will discuss all that, but whenever there is an ovulation, the hormone which will be absent or very very low, excellent, thoko tali clap, it is the progesterone. All these whatever MCQs I am discussing are all the previous year's question, are all the extremely important. Okay, let me just tell you, this MCQs which I will be discussing, yes, this MCQs which I'll be discussing are all MVP MCQ. What is MVP MCQ? Most important high yield. V is virgin MCQ. What it is also I will tell you in some time. And P is the previous year question. Okay. So MVP MCQ, you all of you should know. Okay. Now, as I said, that means all of you remember, no ovulation, no corpus luteum, no progesterone. ये समझ में आ गया. Now when I say, okay, sir, all of us know that, sir, which hormone is responsible for ovulation? LH surge. LH surge is responsible for ovulation. Surge matlab ke like a bullet, and like I'll show you the graph, that it should increase and suddenly drop down like a surge. Now my question to all of you is, after how many hours? Okay, ध्यान से सुनेंगे. I'll also tell you the R. LH surge onset. From LH surge onset, how much time will it take for the ovulation to take place? 12 hours. Let me first please finish the MCQ. Typing, writing 36 hours. Yeah. Okay, VKS Opti, I'll explain to you. Okay, and 60 hours. Yes, chalo. Can anybody tell me the answer over here? From LH surge onset, what is the time for ovulation? Okay, excellent. Okay, so somebody will say 24 to 36. So in the viva, in the exam, if you tell me sir 36 to 48, that is okay. But exactly अगर आपको याद रखना है तो please understand onset is the word and therefore 36 is the answer. Okay, बेटा आपको yes हाँ VKS OPT progesterone वाला formation हाँ. Okay, बेटा there's nothing to be explained. This is your first MBBS physiology कि after ovulation will take place, that structure. ओके ये ओव्यूलेशन हो गया, कैप्सूल विल द फॉलिकल विल रप्चर, इसको बोलते हैं फॉलिकल रप्चर. ओके फॉलिकल रप्चर, follicle rupture. So the egg, please understand this, what we are seeing is the follicle. I'll show you the size also, I'll tell you. So follicle के अंदर होता है egg. So egg is released, which is called as ovulation, and then this structure becomes the corpus luteum, which is secreting progesterone. Clear beta? Yes, VKS-OPT. Is it clear? You can tell me yes. Okay, yes. So after ovulation, this follicle gets converted to corpus luteum, and corpus luteum secretes progesterone. Okay. Now, why this is, I always tell the student, read the question correctly before answering, because majority mistake exam mein hota hai when they don't read the question. After 20 years of teaching, I also know कि which mistake which student is making. I request all of you, मेरा एक YouTube पे बहुत अच्छा वीडियो है, mistakes to avoid in the exam. Title is mistakes to avoid, mistakes which can be costly on the day of NEET PG, but it is not only for NEET PG. Please, all FMG students also, please go. I request, I'll put the link in the our Telegram channel. So please go and see that video. It's going to really be helpful. And of course, I'll be pointing out. Okay. Now, important kya hai? Yes, please understand that you need to remember totally 3 figures. What are the 3 figures we need to remember? Sir, from the LH surge onset, entire onset to ovulation, please pay attention. Entire onset to ovulation, ये है onset मतलब starting, ये है ovulation, it is 36 hours. Onset to reach the peak, इसको बोलते हैं peak or the maximum levels. This is going to take 24 hours. And sir, after the peak is reached, in another 12 hours the ovulation will take place. Is this understood to all of you? So thumbs up. So I want all of you to remember 3 different figures. 24 plus 12 is 36. Is this understood to all of you? So now if I ask all of you, clap if you feel happy. First 5 minutes of the lecture over, 3 MCQs discussed. Okay, 4 MCQs. And the same thing what I showed you in the picture, what I've done, onset to ovulation 36 hours, onset to reach the peak 24, and after the peak 12 hours ovulation will take place. Okay, so now my dear students, अगर ये MCQ आपके सामने है, ये MCQ आपके सामने है, and the question was कि from LH surge onset, when will the ovulation take place? Now if I say from LH surge peak, मतलब peak is already reached. After the peak, when will the ovulation take place? Now chalo, tell me the answer in the chat box. After the peak is reached, when the ovulation take place? Excellent, all of you. Super my dear students. सबका नाम नहीं ले पाऊंगा. Excellent. OG in the chat box. Okay, so 12 hours. तो ऐसे ऐसे क्वेश्चंस आपको आते हैं. तो यस, ये कुछ कुछ मगअप करना है, लेकिन ये कॉन्सेप्ट इंपॉर्टेंट है, वर्ड पढ़ना है. वेरी गुड. सो अगर ऑनसेट से पूछा है, आई रिपीट, ऑनसेट से पूछा है तो 36 आवर्स है. ऑनसेट टू रीच द पीक इज absolutely correct. To 24 hours to achieve the peak, and after the peak we get 12 hours में ovulation. Perfectly correct. Okay, and one more question I told you, which hormone is absent whenever there is an ovulation? The answer is progesterone. And again, if I tell you this question came in one of the this, and no ovulation, no corpus luteum, no progesterone, please remember this rule. This is a 5-star rule. Please keep this in mind. Okay, sir, whenever there is an ovulation, there will be no progesterone. Is this understood to all of you? Now, I want to ask you one more thing. I want to tell you one more thing. The changes in the ovary and uterus take place simultaneously. Okay, so in the endometrium, there is the proliferative phase. Matlab the endometrium is growing, and after the ovulation there is the secretory endometrium. Okay, these are the changes in the uterus. Simultaneously ovary के अंदर जो changes हो रहा है, the first half of the cycle, what is it called? Anybody? The first half of the cycle where the follicles are growing. इसको बोलते हैं follicular phase. And after ovulation, what it is called? The luteal phase. And what is this dividing line? ये dividing line क्या है? Anybody? Between the follicular phase and the luteal phase, what is this event? This is the event of ovulation. Excellent, all of you. Okay, so follicular phase में there is estrogen, and that is why the lining of the uterus is growing. And when there is ovulation, luteal phase में, what is the dominant hormone? 1 year back, 2 years back, INI, CET, MCQ. Please, my dear students, today not scaring all of you. आप लोगों को तो super हो जाने वाला है, but today FMG exam as difficult as the NEET PG. So please don't think, sir, there's only NEET PG teaching, this is FMG teaching. That all was 10 years back. 10 years back, we used to make FMG low level teaching, NEET PG high level. Today, FMG students, I teach the highest level, because then when you know the highest, you will know everything. Okay, yes. Luteal phase, the dominant hormone is progesterone, and progesterone is responsible for secretory endometrium. So these are the changes which take place inside the uterus, to be precise, in the endometrium, and these are the phases in the ovary. Ovary में होता है follicular phase and the luteal phase. Can I get 10 thumbs up so that I know all of you have understood till now? अब तक जो सिखाया last 20 मिनट में, crystal clear? Type in the chat box OG or crystal clear if you have understood it. Okay, yeah, thumbs up. Okay, till now, अब तक जो सिखाया वो, आगे picture अभी बाकी है. Okay, yes, excellent. Okay, now going ahead, very important, very important. The first topic for the day, the first main topic. So this is about the HPU axis, or follicle ka size and all that I will tell you. Okay, the first topic for the day, and that is the topic of infertility. Now, can anybody tell me how infertility? Okay, short 3-4 MCQs come. Infertility is a huge topic. आज दिन भर infertility ही चलेगा, because PCOS, endometriosis, tubal factor, your test for tubal patency, hysterolaparoscopy, all that, and tomorrow a little bit of your IUI IVF. Okay, yes. Now, infertility is defined as, okay, if I ask you true or false, not able to conceive after 1 year of marriage. Yes or no? Not able. Chalo, true or false in the chat box. not able to, this was the MCQ asked 1 year back, 2 years back, not able to conceive after 1 year of marriage. True in the chat box, true or false. Very good. True, 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 false, false, false. हाँ, so all those who, my dear friends, जिसने कहा है true are all wrong. This statement is not true. Why? Why? Because 1 year of marriage since is not important. The marriage is important, but marriage since is not important. Why? Because, sir, if the husband is using condoms or wife is using birth control pill, that is not infertility. Or husband is in India, wife is in America, and that is again not infertility. Yes or no? Do you agree with me? So marriage since is not, this was the question, and many students in the heat of the exam, ha, ye true mark kar diya. No. Why marriage is not important? Yes, not able to conceive after 1 year of regular unprotected intercourse. Okay, regular unprotected sex or intercourse, each and every word is important. It should be unprotected. That's why we say that if the couple, so doctor, we were married for 2 years, but in the first 2 years I was using condoms, the patient tells me, or my wife was using birth control pills, that is not infertility. Is this understood? So not able to, yes, आपका 1 year correct है, 1 year is correct, 1 year is correct, but it is 1 year of not marriage, of regular unprotected intercourse. Now please understand, even if everything is normal, everything normal with the uterus, tube, ovary is normal. With all of you, this is the basic thing. All of you know that for the female to conceive, kya hoga? All of you look over here. This is the uterus. This is the cervix. This is the vagina. This is the fallopian tubes. Okay, this is the ovary. Okay, so the ovary में से जब ovulation होगा, the egg will come, the fimbria will pick up the egg, and the egg will come inside the fallopian tube. At the same time, suppose there is intercourse, then the husband will deposit the sperm in the vagina. उसके बाद Olympic का race शुरू होता है. All the sperm go above, and only one of them gets the gold medal, which is to fertilize the egg. Anybody, where does fertilization take place? FF. Fertilization takes place where? In the fallopian tube. This is a very basic MCQ, but student make a mistake. To be precise, in the ampullary part of the fallopian tube. Very good. Okay, and here the egg and the sperm will unite. And it becomes an embryo, and then the pregnancy is traveling for 4 days. 5th day it enters, and implantation takes place inside the uterus. So don't, ये क्या है? ये बेसिक MCQ है, बट स्टूडेंट एग्जाम में टेंशन में, एग्जाम का स्ट्रेस में, टेंशन में गलत मार्क हो रहा है. करेक्ट? सो आई रिपीट, डोंट मेक अ मिस्टेक. Fertilization, fallopian tube, yes, ampullary part. Implantation, of course, inside the uterus. When? Anybody, when does the implantation take place? On the 6th day. The implantation will take place on the 6th day. 6th, कभी कभी 7th, कभी कभी 8th, but 6th day technically पूछा तो 6th. Yes, we can write 6th to 8th on the 6th day, but on the 6th day of the cycle नहीं, 6th day following fertilization. Okay, fertilization के बाद 6 days में implantation होता है. Okay, yes, post fertilization 6 to 7, 6 to 8, but 6th day. Okay, so I repeat, implantation, please make a note, implantation on the 6th day following fertilization. Okay, तो ये आपका बेसिक है. तो अभी इसमें क्या क्या कंसीव में प्रॉब्लम हो सकता है? सर, मेल फैक्टर, हस्बैंड का Binita Mishra. Okay, yes. Okay, so husband का sperm count may be low, motility may be low, morphology वो सब हम डिस्कस करेंगे. Tube could be blocked, uterus can have a problem, and ovulation नहीं होगा, which we have already told you. Ovulation नहीं होगा तो it is called as an ovulation. Okay. Yes. Now, two things before we begin. Okay. Worldwide. Okay. Worldwide, this an ovulation is the most common cause of infertility in female worldwide. Okay, worldwide, this an ovulation which we are going to discuss, and in that an ovulation, what is the most common cause, all that we'll discuss. Okay, worldwide, an ovulation is the most common cause, but in India, because infection, gonococci, chlamydia, genital tuberculosis is very common in India, the tubal factors. Okay, actually, if you see now, my dear students, actually, if you see, when I look at the causes of female infertility, you can see both are equal numbers. These numbers you are not supposed to remember. Okay, so don't, even if you don't remember, okay, sir, ovarian causes, tubal causes, and lastly, uterus causes 10, 15, and unexplained matlab bad luck, we don't know. Okay, so if you see ovary and tube दोनों का number same है. But if I ask you what is the most common cause of infertility worldwide, ऐसा MCQ आ गया तो please mark ovarian factor. Okay, but if specifically they ask you what is the most common cause of infertility in India, then in India it is better to mark the tubal factor followed by an ovulation. Okay, so ये पुराने बहुत MCQs थे. लास्ट अभी मैंने 5-10 साल से ऐसा MCQ नहीं देखा है, बट यस क्वेश्चन आता था. वी आर टीचिंग यू एनीवेज. ओके, एंड इधर तक ऑल क्लियर. नाउ एनीबडी प्लीज अंडरस्टैंड very important again from your concept point of view. Surely they are going to ask you, okay, why in the definition of this infertility it is 1 year. Now my question to all of you, if the husband is absolutely normal, and the wife is also normal, and they have intercourse at the time of ovulation, understand the scenario. Imagine husband normal, wife normal, and sex or intercourse at the time of ovulation. What is the chance of pregnancy in that 1 month? Okay, if I'm writing H, husband normal, wife normal, and intercourse or sex at the time of ovulation, what is the chance of pregnancy? 50%, 99%, 69 to 75%, 10 to 15%, 0%. Anybody? चलो, guess. Right, wrong, no problem. 99 to 100 range दे देंगे एग्जाम में. Okay, 50 to 60%, 10 to 20%, okay, 5%. चलो, anybody? If the husband is normal and the wife is normal and there is intercourse at the time of ovulation, please understand कि I jokingly tell all my students and my patients कि वो खाली एकता कपूर के सीरियल में होता है, और हिंदी पिक्चर में होता है कि हीरो हीरोइन मीट and heroine pregnant in the first shot itself. Okay, this is nature. So please understand that even if ये MCQ कोई पूछेगा नहीं आपको, but even if everything is normal, इतना high नहीं होता है. 10 to 15%, max 20% is the chance of pregnancy in 1 month. Okay, in 1 month time, there is a chance of pregnancy. Only 10 to 15% couple will achieve a pregnancy. This is nature. Otherwise, instead of 6 billion, will be 60 billion people on planet Earth. Okay. तो ये important क्यों है? Yes, somebody said, okay, but sir, if you keep on waiting, so एक month में 10 to 15%, फिर next month में और 10-15%. Very good. ऐसा करते in 6 months time, roughly 50% couple will conceive. And by the end of 12 months, anybody, by the end of 12 months, how many percentage will achieve a pregnancy? By the end of 12 months, 90% couple will be able to achieve a pregnancy. And the 10% जो बच गया, that is whom I investigate. So please understand, I'm so happy. I teach this every year. Excellent, all of you. I teach this every year, and till now it was a virgin MCQ for so many years. Now, those who are hearing me for the first time, what is virgin MCQ? Virgin MCQ is my terminology, my specialty. So many MCQs in this NEET PG are virgin MCQ. Virgin MCQ matlab the brand new MCQ. Okay, I'm coming to PK, explain करेंगे. Okay, virgin MCQ is brand new MCQs. MCQs not asked till now, but it will come in the future exam, is virgin MCQ. So throughout my next 10 days, I'll be telling this word virgin MCQ. तो तभी ये सोचना मत कि सर virgin virgin क्या बोल रहा है. Okay, हाँ बेटा PK explain what. हाँ, so बेटा it is nature ने इस तरह से बनाया है. The reason is के in 1 month, reason अभी आपको बताएंगे, in 1 month only 10-15% can achieve a pregnancy. So वो ऐड करते जाते, like first month 10-15, फिर another 10, ऐसा करते करते by 12 months time 90% will achieve a pregnancy, and 10% are still going to remain infertile, and those are the ones whom we are supposed to investigate. Why? Because if you start investigating early, stress goes up, and with stress the further success goes down. Okay, so please now tell me, all of you, husband comes to you now, all of you, now PK and all of you, please answer. Okay, husband comes to you and says, doctor, I am married for 6 months. Okay, I know what is the fertile period of my wife. We are having sex on that. We are having the sex at the time of ovulation. We are married since, we are trying for pregnancy since 6 months. And my wife has not yet become pregnant. Question समझ में आ गया? Question ये है कि सर 6 months हो गया है, we are having sex at the time of ovulation, and still my wife has not become pregnant. Will you do my semen analysis? Will you do the wife का HSG? Will you go for IUI, IVF, or will you just wait and watch? Chalo, A, B, C, D. Yes, excellent all of you. Okay, chat box में flood the yes. Okay sir, very good. Wait, husband को क्या बोलना है? Relax हो जाओ, अभी खाली 6 महीना हुआ है. Go back home and enjoy. If after another 6 more months also your wife is not becoming pregnant, okay, wait for another 6 months is the answer. ये MCQ इतना simple लग रहा है, लेकिन ये MC, it's a PYQ. This is a PYQ which has been asked. Okay, after 6 months also, very good Chitranjan, after 6 months also your wife is not becoming pregnant, then you come back to me, and then I will start evaluating the both male and the female partner together. कि हम देखेंगे sperm count, HSG, all that करेंगे use. Is this understood? So क्या वो, because why? If you start investigating early, the stress goes up, and with stress the further success goes down. इसलिए क्या बोलना है? खाली rest, go back home, relax, yoga से होगा. Okay, meditation. Okay, yes, first. Okay, so just relax, and then we will, after another 6 months also your wife is not becoming pregnant, then you come back to me, and then I will do all the investigation. So abhi khali just relax, enjoy. Okay, relax and enjoy. But just by the way, can anybody tell me logical? Can anybody tell me logical? Wait and watch, very good. But just by the way, one more thing, can I start for the patient? Wait तो करना है. Wait and watch is the option है, तो wait and watch. या reassurance option में है, तो reassurance मतलब reassure them that nothing is tension, just wait for 6 months, तब तक conceive हो जाएगा. नहीं होगा तो मैं हूं ना, शाहरुख खान, हमें इन्वेस्टिगेशन करेंगे. लेकिन wait and watch के अलावा, can I start one tablet to the female? Which one vitamin I can start for the female as a general advice, common sense. Because sir, जिंक नहीं, yes. Why vitamin K बेटा? हर्षा vitamin K क्यों देना है? Yes, Neetu, very good. Anonymous, folic acid supplementation wife को, because when anybody is planning pregnancy, we have to give, yes, so we generally put a multivitamin tablet or folic acid tablet. Why? हाँ, zinc is for male, okay बेटा, but वो जरूरत नहीं है, वो तो अगर sperm count में problem है तो, otherwise नहीं. Okay, folic acid you should start for the female, because folic acid is for prevention of neural tube defects. Okay, all of us know, and we have to start at least 1 month before the patient conceives. So any patient, ये just by the way है, in my practice also, if somebody says sir my I get a phone call, students बहुत मुझे phone भी करते हैं opinion के लिए कि sir my sister has got married, they are planning pregnancy, what do? I said please start folic acid treatment, folic acid supplementation start करेंगे, so that for prevention of neural tube. But wait and watch is the answer. Is this clear to all of you? Till now everything crystal clear? Yes or no? Okay, with all this as the background, अब तक भी बहुत सारे questions cover हुए हैं. Okay, with all this as the background, yeah, but I will discuss the dose also in the, okay. Basically we have to give them, please understand there are two different MCQs in folic acid. Then we'll discuss about the dose also. For normally we have to give them actually 400 microgram. Okay, 400 microgram folic acid hai, okay, for prevention of neural tube defect. Okay, is it clear beta? And if already past history, 4 milligram. Okay, so for prevention of neural tube defect, 400 microgram. Okay, 400 microgram. Yes, now please pay attention. With all this as the background, we go on to discuss the first. But iron is not required as such. Of course, you will do the hemoglobin. You can do hemoglobin. CBC is a basic investigation. And of course, hemoglobin is low. You can give her iron tablets. Okay. Iron, if she's feeling weak and all that, yes. But in a perfectly healthy lady, iron we start after the patient conceives. Okay, PK? वो pregnancy start होने के बाद, अभी हम लोग periconceptional period में हैं. They are just planning to conceive. So iron, no harm if you tell them to take iron, multivitamin, protein, good diet, good health, exercise. वो सब तो understood है. Okay, avoid smoking, tell them to stop smoking, tell them to stop alcohol, all that is understood. Okay, with all this as the background, we go on to discuss the first topic in our first topic of the day, main topic in infertility, first main topic in infertility, and that is the first topic in fertility, and that is PCOS. Anybody what is PCOS? Polycystic ovarian syndrome. Okay, or polycystic ovarian disease. PCOS बोलते हैं, PCOD बोलते हैं, दो भी कोई भी चलेगा. Now, if I again tell you true or false, ha, very good. Okay, so if I tell you again true or false, yeah. Okay, so very good. But if I tell you that, sir, as the name suggests, क्या है? Polycystic ovarian syndrome. So there are, what is it? There are multiple cysts in the ovary. Yes or no? True or false? Chalo, in the chat box, true or false? PCOS, multiple cyst, ना name में ही है, polycystic ovarian syndrome, multiple cyst in the ovary. True, false. Very good. Okay, so please understand, very good, ध्यान से सुनेंगे कि मेजॉरिटी बच्चों को लगता है कि सर PCOD मतलब multiple cyst in the ovary, and it is true. No, please understand, it is not true. It is a misnomer. PCOS is a misnomer, मतलब गलत नाम है. And student tell me, thank you very much sir, last 4 years, final year interns, मतलब last 3-4 years we were thinking it is multiple cyst in the ovary. No, after listening to your lecture, we come to know it's a misnomer. There are not multiple cysts in the ovary. I am telling you, there are no cysts only in the ovary. Ovary में कोई cyst नहीं है. अरे सर ये क्या बोल रहे हैं? कोई cyst नहीं है? Yes. Okay. Now please pay attention. PCOS, there was a lot of confusion, and 100% this MCQ is coming in the exam. Only the students who attend my lecture or read my book will get this correct. Other students will not. And 100% this question is coming. What criteria? Anybody? Which criteria are used for diagnosis of PCOS? And that is the Rotterdam criteria. Rotterdam is a place in Europe where the uh, very good. Yes. Okay. Rotterdam criteria. Okay. Which is the, what is the criteria we will by heart? 5-star slide. Okay. Please by heart. This is a 5-star slide. Okay. Rotterdam, it took place in 2003. Up tak correct hai. And totally there are 3 criteria. What are the 3 criteria? Criteria number 1. Okay, sir, there should be an ovulation. Criteria number 2, hyperandrogenism. Hyperandrogenism could be biochemical or clinical. इसका मतलब क्या है? ध्यान से सुनेंगे. Biochemical मतलब के the testosterone is elevated. If I do somebody's blood test, biochemical मतलब blood test. And clinical means what? Anybody? Clinical कैसे पता चलता है? Anybody? What is clinical hyperandrogenism in the chat box? Clinical hyperandrogenism. Yes. Clinical कैसा है? Yes. Sir, by looking at the patient, acne, hirsutism, facial hair, all that. Okay. All this is the clinical hyperandrogenism. And third is the sonography criteria. 12 or more than 12 follicles, 2 to 9 millimeter. मतलब बहुत सारे छोटे follicles are there within the ovary, one or both the ovary. Again picture बताएंगे, which is typically called as the necklace of pearl pattern or string of pearls or necklace of pearl. ये अगर नहीं भी है तो one more, anybody? PG level MCQ. If follicles we are not able to count, then we can also look at ovarian volume or ovarian volume more than or equal to 10 cc. 10 cc. Normally ovarian volume होता है 242, like volume मतलब length into breadth into width. So 10 cc या 10 ml, but generally cc करते हैं. Okay, both mean the same. So if the ovarian volume is more than 10, normally होता है 5 ml, 6 ml, मतलब 1 into 2 into 3 length, like 2 into 3 into length. Okay, वॉल्यूम कैसे करते हैं? ओवरी का लेंथ, ब्रेथ एंड हाइट. ओके, सो नॉर्मली 3 into 2 into 1, सो समवेयर 5-6 ml होता है ओवेरियन वॉल्यूम. ओके ओके, नॉर्मली होता है 5-6 दिस. ओके, नॉर्मली होता है 5-6 ml, बट इफ द ओवरी इज, मतलब बेसिकली बिग बल्की ओवरी. Okay, so I repeat, आपके लेवल पे आप यही रखोगे कि 12 or more than 12 follicles, 2 to 9 millimeter in diameter. But suppose if they don't say, then even ovarian volume is okay. Now is the most important point. Please understand, my dear student, कि 2 out of 3 should be present. 2 out of 3 should be present. All the 3 can also be present. लेकिन I'm so happy. Okay. No, necklace of pearl is a root. Who said not, beta? Okay. 10 is higher. Okay. 10 more than or equal to 10. So 10 thoda higher ही है. Beta, Harsha, necklace of pearl is in Rotterdam. Why it is not there? I told you totally 3 criteria hai na. But I'm coming to your doubt. Any 2 out of 3 should be present. And I'm so happy I teach this every year. And now you tell me the answer. Okay, now you tell me the answer. Okay, suppose if I say this was the question, that I have got a patient who has an ovulation and irregular cycle. she has got acne, hirsutism, oily skin, elevated testosterone level, and on ultrasonography the ovary is normal. If I say, sir, this is PCOS, true or false? As per Rotterdam criteria, this diagnosis is PCOS. Will you tell it true or false? वेरी गुड. हाँ, तो ये गुगली है. पीके शमी जिन्होंने फॉल्स बोला, प्लीज अंडरस्टैंड कि सर ये बहुत कॉमन मिस्टेक था. ये एम्स एमसीक्यू 2 साल पहले कि सर ओवरी इज नॉर्मल, तो सबने बोला सर ओवरी इज नॉर्मल तो ये पीसीओएस नहीं हो सकता है. नहीं, ये स्टिल पीसीओएस है, बिकॉज 2 out of 3 is satisfied. Is this understood to all of you? Sir, she is having an ovulation, she is having acne, hirsutism. Let the sonography be normal. Yes, because sir, this is it clear? जिसने फर्स्ट जिसने कहा वो कौन था? रोटेटम वाला वो कौन? बहुत, हाँ, हर्षा एवी. हर्षा एवी, प्लीज अंडरस्टैंड that yes, necklace of pearl pattern is the most common pattern seen, but that is present only in around 70% patients. 65 to 70, 30 to 35% patients of PCOS. Sir, in about 30% patients of PCOS, the USG can be normal. That means, sir, she is having PCOS, she is PCOS, but the USG is normal. Is this understood to all of you? So if I tell you one more, true or false? Okay, sir, in a patient of PCOS on USG, the ovary can be normal. True or false? Chalo, true or false? Now I want all 100%. अभी सबका correct होना चाहिए वाला true or. In a patient of PCOS on USG, the ovary can be normal. True or false? True or false? Excellent, all of you. ठोको ताली, तालियां बजती रहनी चाहिए. Clap if you feel happy. Clap if you learned something new on a Tuesday morning. Okay, sir, absolutely correct. Absolutely correct. Absolutely correct. Okay, sir, ovary can be normal. Ovary can be normal. Yes. So please again don't make a mistake. दो separate MCQs आएंगे. दो separate MCQ आते हैं कि what is the most common pattern seen? Sir, necklace of pearl. Necklace of pearl is the most common pattern. Okay, necklace of pearl is the most common pattern. ओके, नेकलेस ऑफ पर्ल या नेकलेस पैटर्न जो बोलते हैं वो मैं ड्रॉ करके भी आपको बताऊंगा, एक्चुअल पिक्चर भी बताएंगे. सो नेकलेस इज द मोस्ट कॉमन पैटर्न या यूएसजी पिकर नेकलेस या स्ट्रिंग ऑफ पर्ल्स. बट सर, बाय द वे, यूएसजी कैन ऑल्सो बी नॉर्मल. इज दिस अंडरस्टूड टू ऑल ऑफ यू? तो ये बहुत इंपॉर्टेंट है. दैट मीन्स henceforth माय डियर स्टूडेंट, इफ इन द एग्जाम टेक होम मैसेज ये है कि 2 out of 3, if 2 out of 3 is positive, you can safely mark the patient as PCOS. So necklace of pearl is the most common pattern seen, but it can be normal also. Okay, now why does all this thing happen? Is there is excessive testosterone production within the ovary. Is excessive testosterone production, तो उससे होता है acne, hirsutism. Now my question to all of you, and now you will understand कि वो क्या था, follicle है, PCOS है, क्या है. कि all of you, as I told you, कि normally the follicle is small starting में. Okay, the follicle starting में is small, then the follicle becomes big, then the follicle becomes big, then the follicle becomes big. What is the size of the follicle? What is the size of the follicle just before ovulation? Chalo, anybody? ये जो follicle बढ़ता है बढ़ता है बढ़ता है बढ़ता है, what is the size of the follicle just before ovulation? Very good. लेकिन all of you, my dear friend, 18 to 20 what? Dark black, Anju, 18 to 20 kilometers. Correct. 18 to 20 kilometer. 18 to 20 centimeter. 18 to 20. हाँ, and बेटा 24 नहीं बेटा, overshoot हो गया, anonymous overshoot हो गया 20. Yes, very good. Not 18 to 20 kilometer. Okay, so please be very clear. Okay, is it clear to all of you? So please understand, कहने का मतलब ये है कि सर स्टार्टिंग में फॉलिकल छोटा होता है, से 2 to 5 मिलीमीटर, फिर बढ़ गया 10 to 12 मिलीमीटर, फिर और बढ़ गया 14 to 16 मिलीमीटर, और फिर बढ़ गया 18 to 20 millimeter. Anybody, what is the name of this follicle? This is called as, what is this 18 to 20 millimeter follicle called? Revision of all your it's called Graafian follicle, and also we call it as dominant follicle. Yes, dominant, because in month. Okay, so Graafian follicle, yeah, dominant follicle. Okay, and please understand, okay, this is the follicle. This I can see on sonography. Okay, this I can see on sonography. Within the follicle is the egg. Within the follicle is the oocyte. Oocyte is microscopic. वो नहीं देख सकते हैं. Okay, is it clear? तो follicle I can see. Is this understood? And my dear student, अब समझ में आएगा कि PCOS में क्या हो रहा है. Sir, in PCOS, all the follicle will remain in the range of 2 to 9 millimeter. Is this understood to all of you? All the follicle will remain in the range of, all the follicles will remain in the range of 2 to 9 millimeter. Okay, that means sir कोई follicle 2 का है, कोई 4 का है, कोई 6 का है, कोई 8 का है. None of the follicle, all of you can see this, 12 or more than 12 follicles, 2 to 9 millimeter. मतलब इनने बेटा chocolate cyst अलग है बेटा अब्दुल. Chocolate cyst next topic. Chocolate cyst is endometriosis. Don't get confused. Chocolate अभी बाकी है मेरे दोस्त. Okay, chocolate खिलाएंगे आपको आधे घंटे बाद, 1 घंटे बाद. Okay, is this understood? कि sir, in PCOS, all the follicles are remaining in the small size. Okay, all the follicle which you will see, some follicle will be 2 millimeter, some will be 3 millimeter, some will be 4 millimeter, some will be 8 millimeter, some will be 9 millimeter. So all the follicles are between, 2 to 9 millimeter. Thumbs up, understood. लेकिन follicle को कितना बढ़ना है? Follicle को बढ़ना है 10, 14, 16, 18, 20, 18 to 20 तक जाना है. And therefore, my dear students, the real name of this condition should be polyfollicular ovarian disease या polyfollicular ovarian syndrome. Clap if you have learned something new. Okay, sir, and it's a misnomer. Okay, sir, this small follicle, they look like cyst. So can anybody tell me वो follicle है कि cyst है? If somebody says they are not cyst, ask all your friends, those who are not learning from me. सब बोलेंगे sir cyst in the ovary, cyst in the ovary. No, they are not cyst, they are small follicles. Okay, follicles look like cyst, तो by chance नाम पड़ गया polyfollicular ovarian syndrome. Okay, now very important, in PCOS we have to measure in any patient, I have to measure the FSH and LH levels. FSH LH levels if I have to measure in any patient normally. Then which day of the menstrual cycle, will we measure the FSH-LH. Chalo. FSH-LH should be measured on which day of the cycle? When I say day of the cycle, whenever the menses start, that is day 1. Excellent, all of you, excellent. Okay, sir, FSH-LH levels are to be done. Please remember this. Those who want to become gynecologist lifelong and those who are not want to become gynac till your entrance exam is over, please understand FSH-LH I do always on day 2, day 3 of the cycle. Very, very important MCQ, 5-star MCQ. Reason, nobody will ask you. I'll still tell you the reason. The reason is that I want to know the baseline level. What is the level at the beginning of the cycle? Okay. तो again याद रखेंगे कि sir FSH-LH should always be on day 2 or day 3 of the cycle. Important MCQ. Normal patient, the ratio is 2:1. And in PCOS, the ratio becomes inverted or ulta. It becomes 1:2 or 1:3 or sometimes even 1:4. Yes, because we want to know the baseline level. What is the level at the beginning of the cycle? इसलिए हम and what is this day 2, day 3? It means when the menses start, that is day 1. Okay, remember student. This is not day 2 of the month. 2nd August, 3rd August नहीं है. Whenever the menses start is called day 1. So अगर आज menses start हुआ, कल जाके उसका ये करना है. Okay? Okay, is this understood to all of you? Yes, so all these are the extremely important MCQ. कि FSH-LH कब करना है? Day 2, day 3. Normally क्या है? 2:1. And in PCOS, what is the ratio? In PCOS, sir, FSH to LH ratio can become 1:2 or 1:3 or even 1:4. इसका रीजन क्या है कि LH is going to be very, very high. बस पेशेंट इज नॉट ओव्यूलेटिंग, तो ओव्यूलेशन करवाने के लिए LH और बढ़ता रहता है एंड देयरफॉर ये आपका LH बढ़ जाता है. ओके, नाउ या PCOS में लेवल्स आर डिफरेंट देन द नॉर्मल ना, करेक्ट. सो ये दोनों आपको याद रखना बेटा. ओके, वीके नॉर्मल पेशेंट का रेशियो भी बता दिया, ये भी MCQ है कि नॉर्मली इफ दे टेल यू व्हाट इज अ नॉर्मल रेशियो. Yeah, because that's what I told you. Okay, LH is going to be high. LH is in PCOS, the LH is going to be very, very high. So LH बढ़ जाता है तो रेशियो हो जाएगा उल्टा 1:2 or 1:3 or 1:4. FSH is normal or FSH is slightly low, but LH will definitely be high. So normal patient 2:1. ये उल्टा हो गया ना बेटा. VKS उल्टा हो गया ना. You can see LH बढ़ गया तो ये 2, 3, 4 denominator में आ गया 4. Okay, now is the most important point. Okay, and as I told you, which hormone is absent in PCOS? Which hormone will be absent in PCOS? If I tell you which hormone is absent or lacking in patients of PCOS? एक्सीलेंट माय डियर स्टूडेंट. सुबह सिखाया, आधे घंटे बाद रिवीजन. दैट्स वाई बेटा आप लोग मेरा जैसे मैं कहता हूं सुनते जाओ. सब नोट्स बिट्स का कुछ टेंशन मत करो, दिमाग में छप जाएगा. lifelong you will remember this. Okay, sir, in absent in PCOS, sir has told us, okay, sir, whenever there is an ovulation, progesterone is going to be absent. Progesterone is going to be absent, and that is the thing. Okay, sir, whenever there is an ovulation, PCOS में an ovulation है तो progesterone is absent, and therefore remember the rule. Okay, whenever there is an ovulation, this is the rule. Okay, estrogen is present but progesterone is absent. Is this understood to all of you? तो estrogen है लेकिन progesterone नहीं है, and therefore anybody, can you tell me if month after month only the estrogen is stimulating the lining of the uterus, खाली बॉडी को मिल रहा है estrogen लेकिन प्रोजेस्टेरोन एब्सेंट है, व्हाट इज द लॉन्ग टर्म कॉम्प्लिकेशन? व्हाट इज द लॉन्ग टर्म कॉम्प्लिकेशन? Chitranjan, not endometriosis, long term complication. Yes, Sangeeta, you're almost there. Okay, endometrium will keep on increasing. So estrogen will keep on increasing. So if month after month, repeat my question, if month after month only the estrogen is stimulating the lining of the uterus, yes sir, because of this unopposed estrogen, the complication is very good, endometrial hyperplasia, endometrial cancer. All this will be discussing after some time. Yes, fibroids can also happen. Very good. Yes, very good. Very good. Excellent. Dark black, Masood, Bin, Sangeeta, all of you. Yes, heavy bleeding bhi ho sakta hai baad mein. Yes. So remember this. So don't start crying. If any of your sister, friend, relative, girlfriend is PCOS, don't start crying. But अगर treatment नहीं किया तो because of this unopposed estrogen, there is a risk of endometrial hyperplasia, endometrial cancer. पूछेंगे क्यों? तो progesterone is lacking. Okay, now very important. Patient of PCOS has come to you and she says, doctor, I am infertile. Anybody? Why is this? Beta hypo nahi, Masood, hyperplasia. Yes, so typing mistake hai uska. Yes, hyperplasia. Okay. So, chalo, tell me the answer. Patient of PCOS comes to you with infertility. 4 options. Okay, I'll tell you. Now tell me one word answer. Why is there infertility? PCOS infertility. Now please understand, exam में ऐसा directly PCOS नहीं देंगे. Exam में बोलेंगे patient has got acne, hirsutism, irregular periods. Okay, she is obese, obesity, ये सब ऐसा picture देंगे आपको. Okay, and infertility. So now what next? Of course, weight loss, diet, exercise. Chalo, A, B, C, D. Small follicle, very good. How many for A? How many for B? How many for C? Very good. Now please understand, ओसिपिल्स कब देना है? I will tell you in a minute. ओसिपिल अभी नहीं देना है. Why? I will tell you. Please understand. Excellent. Coming back to this MCQ. Okay, sir, whenever there is infertility, one word answer, infertility is because of an ovulation. Obviously, if you're not producing egg, you are not fertile. So what am I supposed to do to make her fertile? We are supposed to make her ovulate, and we have to go for ovulation induction. We have to go for ovulation induction. Yes, and clomiphene citrate was the drug of choice. Please understand this. Clomiphene citrate, write down, was the first drug of choice. This is so very, very important. And this MCQ surely is coming in the next 1 to 2 years, because majority students मेरे जो छोड़ के हैं सब clomiphene mark करेंगे. Please understand this. Clomiphene citrate was the first drug of choice. Today, letrozole is now the first drug of choice. Why this change happened is because letrozole, yes, is giving more pregnancy rate, more success rate, more live birth rate, and less chance of complication. And therefore, my dear students, please, we will by heart this, that whenever there is a patient who is infertile with PCOS, we will first prefer to use letrozole. Second, we might give clomiphene citrate. Is this understood to all of you? Can I get 10 thumbs up? Now, so what's the answer to this MCQ? Not clomiphene, letrozole. Anybody? Why not OC pills? Why not OC pills? OC pills देंगे तो पेशेंट बोलेगा ये डॉक्टर पागल है, डॉक्टर पागल है. वाई डॉक्टर पागल है कि ओसी पिल्स कब देना है, आई विल टेल यू. लेकिन कॉमन सेंस पेशेंट बोलेगा सर आई एम इनफर्टाइल, I have come to you to plan pregnancy and you are giving me OC pills. So yes, OC pills we will give. Yes, OC pills I will give, but when I will give you, please give me 4 minutes, 5 minutes, I will tell you in some time. तो OC pills भी use होगा. Yes, OC pills we will give, but not for the infertile patient. Infertile patient, we have to go for ovulation induction. That is the take-home message. And letrozole is the first drug of choice. Please keep all these points in mind. Yes or no? Understood? Now the last thing. Sir, suppose letrozole diya, clomiphene diya, both these are anti-estrogenic. They will increase the, yes, patient, yes. So OCPL will be given for symptom. We are coming to that. Yes. So when to give OCPL will be starting. Yes. Correct. Very good. So letrozole, clomiphene we will give to make her ovulate. Now suppose इससे काम नहीं हुआ. Okay, these are all oral medicine. These are oral medicines. इससे काम नहीं हुआ तो क्या करेंगे? As a last option, last resort, we will have to give the drug which is HMG. They are injections, because please understand ये letrozole and clomiphene क्या करेगा? They will make the FSH increase. तो follicle बढ़ेगा. तो follicle बढ़ेगा. Very good. So same thing I can give by injection. Sir, if I can give clomiphene, if I can give letrozole, can I directly give the FSH? Yes, sir. Either a recombinant FSH or एक छोटा सा source जिसके लिए एक story. Okay. Yes, not very expensive. Yes. Okay. So please understand this. Okay. What here my concept of master and servant. What I told you in the first line, sir, pituitary is the master and ovary is the servant. Yes or no? Pituitary is the master and ovary is the servant. So जैसे जैसे आपका servant आपके घर पे भी, yes or no, all of you look over, आपके घर पे आपका servant का अगर बराबर काम नहीं करता है, तो what your parents will say or mommy will say, will shout कि बाबा work, काम करो. A day will come when the servant will say भाड़ में जाओ, मैडम बस बहुत हो गया, अभी हम और तुम्हारा काम नहीं कर रहे हैं, हम तुम्हारा काम छोड़ के जा रहा है. And that time your mother will shout the loudest, okay, go, get out, जाओ, निकल जाओ. Okay, yes or no? Same thing is happening. कि सर अगर हमारा servant बराबर काम कर रहा है, master is okay. Now all of you tell me, as the patient age advances, okay, 20, 30, 40, 50, what is happening? the ovarian function is decreasing. Common sense. 20-year-old, 30, 40, फिर 45, 50 पे तो आ गया, and one day the ovarian function completely stop, which is called what? Menopause. When the ovarian function is completely over, this is menopause. Please understand all this. Nobody will ask you. It's my love for the subject. I first teach the slides, then show the slides. I'm not like other people who just directly come and read the slides. I can directly just read the slide and tell you, this is it. No. That's why the students love my lecture, and they say, sir, once we listen to your lecture, we remember things for a long, long time. And we have attended so many OBGY classes, but when we come to your class, things go in my permanent memory. Okay, so master servant relationship से हमको ये पता चलता है कि sir, whenever the ovarian function will stop, that time the master will shout the loudest. That means what am I saying is कि sir, as the patient age advances, हाँ बेटा वही बाकी है बेटा, यास्मीन वही डिस्कस कर रहा है. As the patient age advances, what is happening? Ovarian function is going down. ये है ovarian function. So at the same time, what will happen to the FSH? Sir, FSH is rising, 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 rising. Do you agree with me or not? Yes. कि सर जैसे जैसे ओवेरियन फंक्शन कम हो रहा है, FSH बढ़ रहा है, इनवर्स. And when the menopause is reached, whenever 45, 50 years, whenever the menopause is reached, that means whenever the ovarian function is permanently finished, whenever the ovarian function is permanently over, FSH will become the highest. Do you agree with me? यास्मिन अभी समझ में आ गया बेटा? तो कहने का मतलब क्या है कि सर all post menopausal lady FSH is very very high. That means I'm talking to all the girls in the classroom. What FSH is there in your blood? Higher value will be in your elder sister's blood, higher value in your mother's blood, and highest will be in the grandmother's blood, in your grandmother's blood. समझ में आ गया? Because sir, as the ovarian function will decline, as the age will increase, ovarian function will decline, FSH keeps on rising, rising, rising. And therefore, my dear students, all of you can do some social surveys. Okay, whenever you reach menopause, तो menopausal lady का blood में बहुत ज़्यादा FSH है. तो menopausal lady urine also that FSH comes, which is HMG. Okay, is it clear, beta Yasmin, Jafar? HMG is human menopausal gonadotropin from the urine of the postmenopausal lady. So all you doctors, all of you can do a social service. Whenever you reach menopause, you can go to the laboratory and donate your urine, and from that urine we will get lots and lots of HMG, because human source, human menopausal gonadotropin. Is this clear? So your urine, clap if you feel happy, smiley emoji, laughing emoji if you like this. कि pathology में क्या बोलते हैं कि your blood can save somebody's life. Yes, that's why we say donate blood. So blood can save somebody's life. But doctor gynec में बता रहा है कि your urine can give somebody new life. Your urine मतलब urine of the postmenopausal lady. Okay, urine can give somebody new life. कैसे? कि सर whenever there's a postmenopausal lady, उसका urine में क्या होगा? बहुत ज़्यादा HMG होगा. Human menopausal gonadotropin. Okay, so urine can save somebody's life. So therefore donate urine. So sir medicine में बोला donate blood, sir बोल रहे हैं donate urine. Okay, so therefore again let me see if you have understood this crystal clear concept or not. If I ask the student which age group or which population will have the highest FSH, and if my option is puberty girl, reproductive age group, perimenopause, highest FSH in the blood, okay, highest circulating FSH, okay, and post-menopause. What is the answer? Anybody? Chalo, in the chat box. Which age group or which population will have the highest FSH in the blood, in the serum? Excellent. Sir, perimenopause will be high, but highest will be in the post-menopausal age group. Is this understood to all of you? And therefore now is it clear, Yasmin and all of you, कि सर अगर post menopausal का blood में बहुत ज़्यादा FSH है, then in the urine blood donation कोई नहीं करेगा, लेकिन urine में भी FSH will be very very high, which is yes, beta Shami, if you don't treat it, yes, if it is unopposed, if for 15, 20, 30 years, if you have not treated PCOD, then when you become menopausal, chance of menopausal endometrial cancer is high. It's a long-term complication. So again, I will repeat that. Okay, I will repeat that. It's a long-term complication. Okay, long-term complication. Yes, if we leave it untreated. ओके सो ये समझ में आ गया कि सर HMG इज फ्रॉम यूरिन ऑफ द पोस्ट मेनोपॉजल लेडी एंड दैट इज आल्सो FSH in the urine, that is your HMG, human menopausal gonadotropin. ओके नाउ इससे क्या होगा कि सर आई वांट वन एग टू ग्रो, लेकिन जब हमने ये मेडिसिन दिया, multiple pregnancy can also happen. Numbers we are not supposed to remember, because sir, instead of one egg, multiple eggs can start growing. Instead of one egg, multiple eggs can start growing, so there's a risk of multiple pregnancy. Okay, is this understood to all of you? 3 to 8% with clomiphene, 15 to 30% with gonadotropin. There is one more complication of this, which is OHSS, which we will discuss later on after IVF. Okay sir, when there's a very important image. Okay, now come to this part. Okay sir, patient says, okay sir, right now I am not married, and right now sir I don't want babies, but I am not getting my periods because of PCOS. डॉक्टर साहब पीरियड्स नहीं आ रहा है, 2 महीना 3 महीना 4 महीना हो गया, do I treat it or do I don't treat it? Yes, why should I treat it? You can say no problem, period nahi aa raha hai, no problem, don't have periods, you are 20, 22, don't have periods for 3, 4, 5 years. Whenever you want to become pregnant, you come to me, I will make you pregnant. I will make you pregnant means I will not make you pregnant, I will give you letrozole, clomiphene, and then you will become pregnant. Yes, sir, if I don't treat this amenorrhea, this is estrogen induced amenorrhea. Very good, excellent, all of you. If you don't treat it, that is the long term complication usko ho sakta hai, endometrial hyperplasia, endometrial cancer. Okay, and that is the reason when the patient says, sir, I want my treatment for acne, I want my treatment for hirsutism, and I, like my other friends, like my all other friends, I should get regular periods, I have got irregular periods. तो ये सब का treatment है. You will say, okay, you can take OC pills. How, when OC pills, all that we will tell you in some time in the next class, because OC pills are symptomatically treating the patient. Symptomatically they are treating the patient, and OC pills say the cycles become regular, acne will become regular, hirsutism will become regular, and even irregular periods will also become मतलब acne will become lesser, acne कम हो जाएगा, hirsutism will become lesser, and even irregular period cycles will become regular. That is by OC pills. Okay, don't worry, when I teach you OC pills further I'll discuss that. So, and for God's sake, as I said, please don't interchange the treatment. So many times I have seen a young girl, unmarried girl with acne, hirsutism, doctor is giving letrozole, so we cannot interchange the treatment. Is this understood to all of you? हाँ बेटा पीके पिक्चर अभी बाकी है. How OC pill will work, next कल आना पड़ेगा, कल जब contraception सिखाएंगे. Okay, how OC pill will work, OC pills will make the cycles regular, and OC pills we will discuss will make the acne, hirsutism also less. And therefore please understand this, clap if you feel happy. As I said, कि they are made for each other. Made for each other का मतलब क्या है कि made for each other का मतलब क्या है कि PCO उल्टा कर दो OCP. समझ में आ गया? ठोको ताली, क्लैप. ओके, पीसीओ ओसीपी का मतलब क्या है? पॉली, नाम में ही आंसर है, पॉलीसिस्टिक ओवरी ओरल कॉन्ट्रासेप्टिव पिल्स. हाउ ओसीपिल्स? सर ओसीपिल्स व्हेन आई डिस्कस कॉन्ट्रासेप्शन बताएंगे कि सर ओसीपिल्स से ऑल द सिम्टोमैटिकली ट्रीटमेंट हो जाता है. एक्ने विल बिकम लेसर, hirsutism will become lesser and cycles become regular. Okay, but occipils can't give you babies, and therefore when there is a pregnancy ka planning, when the patient wants to conceive, that time I have to go for ovulation induction. Okay, is this understood to all of you? Yes, super. Okay, so you can tell all your friends about this beautiful thing, PCO OCP, and tell them that's understood. Okay, yes, now please pay attention. Along with this, what they also found out was that a patient of PCO has got something called as insulin resistance. So can I give something to tackle the problem of insulin resistance? Insulin resistance को tackle करने के लिए what can we give? Metformin. Metformin is the drug to tackle the problem of insulin resistance. Now, metformin ka anybody, what is the most common side effect of metformin? So please understand, no hypoglycemia never. Okay, this is a tricky MCQ. Lactic acidosis is not the most common side effect. Clap if you have learned something new. The most common side effect is nausea, vomiting, bloating. Jab said the lactic acid is the most dangerous side effect. Okay, so please keep this in mind. Very, very important. Insulin resistance is considered like a main problem in PCOS. Where exactly insulin resistance plays a role, we don't know. Insulin resistance का मतलब ये है कि the body is not able to recognize insulin. And I'll also show you in the skin में क्या होगा. It's a dermat MCQ. Anybody? Insulin resistance से skin में क्या होगा? Black velvety patches of skin, उसको क्या बोलते हैं? Acanthosis nigricans. Okay, this picture also I will show you, don't worry. Okay, most commonly used drug is metformin. Metformin will help the patient in weight loss and will also increase the ovulation rates. And please keep in mind the famous 2 MCQs. The most common side effect, nausea, vomiting, bloating, GI upset, and the most dangerous side effect, lactic acidosis. Is this understood to all of you? So don't get confused between the most common side effect and the most dangerous side effect. Is this understood to all of you? Yes. Okay, and in this insulin resistance, okay, is this clear to all of you? Nothing more can be asked to you in any of the topic is my guarantee in this. याद रखेंगे most common side effect of this. And by the way, please understand this, metformin सबको पता है. Virgin MCQ after few years. Can anybody tell me if metformin is not tolerated by the patient? Patient is saying, doctor, I've got nausea, vomiting, bloating. Can a newer, what is a newer drug? New drug, which is myoinositol. Highest level of gynecology which anybody can teach you and anybody can ask you. Myoinositol, they will teach you in biochemistry. It's a new drug, myoinositol. can also be used to tackle the problem of insulin resistance, but not as effective as metformin. Okay, metformin is the first thing. Metformin is the first and the best drug for insulin resistance. But if the patient is not able to tolerate, just remember that myoinositol is a new drug. The thing is, it has got less side effect. Okay, less side effect, but not very effective. So nausea, vomiting, less GI side effects, or almost no GI side effects. Okay, is this understood to all of you? This last thing in this second last thing which we should know. Yes. Now, anybody, what is this in the history of image-based question? In the history of image-based question, this was the first image asked anytime. Okay, this is the ultrasonography picture, and all of you can see what. Can all of you see this follicle? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 follicles. Okay, तो ये क्या है? Yes, so this is the typical necklace of pearl pattern or string of pearls. And if I measure the follicle, how much will be the follicles, all of you? If I measure this follicle, what will be the size of this follicle? Sir, all the follicles will be between 2 to 9 millimeter. Thoko tali. Okay, and what should be the actual follicle? So ये छोटे छोटे follicles हैं. Actually the follicle should become 18-20 millimeter in size. Okay, so this is the necklace of pearl pattern, and therefore please understand this. Ordinary students, normal student will say, so these are the cysts in the ovary. Sorry, my students, special students will say this is not the cyst, these are the small follicles, small immature follicle. Is this understood to all of you? And yes, this is on the right side is the laparoscopy view. What is laparoscopy? What is hysteroscopy? All that I will teach you. This is the laparoscopy view. Why? This is the uterus, and this we can see is the big bulky ovary. So this is just for the, we don't do laparoscopy routinely for diagnosis, but just to tell you that the ovary is increased in size and volume. Okay, so ovary ka size is increased. Yes, and ovary size is increased, ovary volume is increased. So this sometimes is like pearly white oyster ovaries. Okay, oyster ovaries. So this is the laparoscopy view. This is the uterus. This is the big ovary. Okay, yes. Yeah, we can. The polyfollicular ovarian syndrome is the best name, PFOS. Yes. Okay. Uh, that's okay. So that is, these are all small immature follicles. Okay. The last thing, only just to complete the topic, never ever asked, hardly ever asked. Okay, sir, suppose if the patient is infertile, and we give letrozole, not working. I give clomiphene, not working. And finally, I give this HMG or recombinant FSH, and that is also not responding. So infertile patient not responding to medical management. No response, matlab no ovulation to all the injections. Then as a last resort, very rarely done, we can go again. This is a laparoscopy route. This is the uterus, you can see. This is the ovary, and we are drilling holes into the ovary. This is hardly ever done nowadays, very rarely done, almost never done. And this is laparoscopic ovarian drilling. But my dear student, this will be as a last resort, last option. आप drill करोगे, how the surgery works exactly we do not know. This is also called as laparoscopic ovarian drilling or LEOS. Yes, this is a last resort, very rarely done nowadays. Okay. Is this understood to all of you? So in exceptional cases, we may have to do this. Okay, nothing more could be asked to you in any of the topic of endo of this PCOS is my guarantee. And moving on, then we'll go on a small break. Moving on to the next topic, and that is the topic of endometriosis. Okay. No, beta. So anonymous, last resort is drilling. Matlab, most of the time patients will respond to this. Okay. Anonymous, most of the infertile patients will respond to HMG and FSH. Only if they don't respond, then as a last option we do uh, laparoscopic drilling. Okay, so it's not preferred so much. But if they tell you in the MCQ, all medical injections have been tried, HMG injections, HMG is injection, clomiphene letrozole is tablet. Yes, last resort to treat infertile, only PCOS. Yes, only for PCOS. Treatment for hirsutism, beta, Ocipil, Sultan. Okay. Ha, beta, we will discuss that. Mala Pyrachan. Cyproteron is progesterone, and that's a part of your Ocipils. Separately, cyproteron is not available. So don't worry, Mala, you'll have to just wait for 24-48 hours. Tomorrow class, when I teach you contraception, I will tell you which is the progesterone, not only cyproteron, which are the other progesterones available for treating Ocipils. अभी खाली याद रखना है कि ये टेबल याद रखना है कि पेशेंट को खाली एक्ने, हिर्सुटिज्म, इरेगुलर पीरियड है तो ओसिपिल्स बेस्ट है, एंड इनफर्टिलिटी है तो लेट्रोजोल बेस्ट है. ऑफ कोर्स दोनों में मेटफॉर्मिन तो देना है if there is insulin resistance. And therefore weight loss, diet, exercise management, all this is extremely important. Okay. Okay, now all of you, very important next topic of discussion, and that is endometriosis. Now what is endometriosis? All of you please pay attention. It is functional. No beta, clomiphene, the wrong, ulta question, beta wrong. Yes, PK. PK, वो जो knowledge है वो पुराना, अभी fresh. Okay, isn't clomiphene the drug of choice? Beta wrong information you have got, old information. Clomiphene was the drug of choice, now letrozole. That's the chain, na? That's why मैं हूँ ना. That's why you come here for lectures. That's why if you read the books, you don't get value marks. You get when you listen, you get. Okay. Now what is endometriosis? Sir, it is the functional endometrium. It is the functional endometrium which is growing outside the uterus. Okay. The endometrium is over here actually, but for some unknown reason, the endometrium starts growing outside in the pelvis, pouch of Douglas, tubes, uterus, ovary area, ovary. So it is the anybody, what is exactly endometriosis? And this endometriotic spots which are there, these are called endometriotic lesions. Will they respond to hormone? Yes. So they are functional endometrium. They are functional. Anybody wants the meaning of functional? Yeah, in the pouch of Douglas fauces. What's the meaning of functional endometrium? Correct. Very good, Jay. Outside the uterus. But what's the meaning of functional endometrium? Yes, okay, sir, they will behave in the same way like how this endometrium will behave. How this endometrium will grow with estrogen and progesterone and then withdrawal, bleeding, there is shading of the endometrium. These also endometriotic will erupt like a volcano. And therefore, my dear students, remember when I tell you the word endometriosis, volcano याद रखना है. Those who are hearing me for the first time. हाँ, करेंगे, वो करेंगे ना मैडम, absolutely correct, retrograde. Okay, yes. So, volcano. Why volcano? मतलब sir, they will also erupt like a volcano. these endometriotic spots also, when there will be the time will come, they will erupt like a volcano, and these also bleed. Okay. Now, what are the sites for endometriosis? Anybody? What is the most common site? If I ask you, what is the most common site for endometriosis? Yes, ovaries number one. Name it, ma'am. Ovaries number one, pouch of Douglas number two, and uterosacral ligament number three. And ovary के अंदर होता है chocolate cyst. Now, can I eat this chocolate? No. Why can't I eat the chocolate? They're also called as a endometrioma. Endometrioma, chocolate cyst of the ovary, pouch of Douglas number two, uterosacral ligament number three. Okay, तो ये याद रखना है. And the important word is functional endometrium. Functional. Okay, functional endometrium at places other than the uterus. Okay, so that's why it's also called as ectopic endometrial tissue. Now, how does this endometrium grow outside? Okay, exactly, we don't know. Yeah, by the so this is ovaries, pouch of Douglas, uterosacral ligament, and other, it can go anywhere. Endometrium can be anywhere in the blood. It can be pleura, ye wo. Last thing, remember, I'm so happy I teach every year. This year, NEET PG. Very rarely, even scar endometriosis. Scar endometriosis matlab scar of LSCS. Long-term complication, even episiotomy scar. That means the patient will have an endometriotic nodule in the scar tissue. And every time during menses there is severe pain. We'll discuss the symptoms and all that in some time. But remember, scar endometriosis is a rare site with scar, LSCS scar, and even episiotomy scar. So in that scar, so क्या होता है? Just by the way, I'll just tell you this कि ये अगर आपका skin का जो scar है, ये this is the LSCS scar on the abdomen. So यहाँ पे एक endometriosis का nodule बन जाता है. Bluish purplish nodule, and every time during menses the patient gets severe pain and bleeding from that part. Okay, and then when you go and you will see like this bluish purplish nodule. Okay, so that's a very rare site, scar endometriosis. Okay, absolutely PG level, but may come in the future exams. Okay, scar endometriosis. Okay, now coming to that, yes. Yes, sir. How does the endometrium reach outside? All the theories don't remember, but number one word याद रखेंगे, Samson's theory of retrograde menstruation. That means what? Please pay attention. Samson's theory का मतलब क्या है? Okay, sir, as you rightly said, so normally the endometrium is going to come out. Normally the endometrium is going to come out during menses, but sometimes the endometrium can enter backflow and come in the pelvis and the ovary. Is this understood to all of you? Beta, you will understand this when I will tell you. Okay, dark black. Okay, I'll tell you the okay. So basically, scar endometriosis is the presence of endometrial tissue in the scar. This direct implantation theory है ना? Direct implantation theory is for scar endometriosis with scar, LSCS scar on the skin, in the skin and the subcutaneous area. Okay, and not the scar on the uterus. Okay, is a scar on the skin. In this LSCS scar on the skin plus जो subcutaneous area में होता है, skin का scar in the skin, and similarly in the episiotomy scar. So what happens is every time during endometriosis, if anything they tell you na during menses, the pain is more, there's bleeding, then think of endometriosis. because endometrium is related to pain. Okay, and lastly, please remember, smoking is protective for endometriosis. That does not mean everybody should start smoking. No, we are not promoting smoking. Smoking is harmful, but smoking is protective for endometriosis. Any other place where smoking is protective? Anybody? Any other place where smoking is protective? Ulcerative, very good, Sultan. But मेरे वाले branch में obs gynae में smoking is protective at 3 places. Very good, dark black fibroids. हाँ, ulcerative yes, लेकिन मेरे वाले branch में fibroids, endometriosis and preeclampsia. That does not mean all pregnant lady. Preeclampsia, very good. That does not mean all pregnant ladies should start smoking, but for some unknown reason smokers में preeclampsia कम होता है. Okay, we'll discuss that. Don't worry. जब हम preeclampsia बताएंगे, we'll repeat all these parts. Okay, now all of you pay attention. Nobody told me why do I call it chocolate cyst? इसको chocolate cyst क्यों बोलते हैं? Why do we call it chocolate cyst? Yes, because sir, blood when I keep it, it's nothing but the altered blood. Blood when I keep it at one place, that reddish color will become brownish blackish in color. Very good. Old blood, clotted blood, old blood is chocolate color. Very good, all of you. इसलिए उसको बोलते हैं chocolate cyst. Another word is endometrioma. Okay, so the meaning पता चल गया, sites पता चल गया. And one more very important point. Anybody, what are the symptoms? And clap if you feel happy. Symptoms के लिए याद रखेंगे अपना famous mnemonic, Dance India Dance. Dance India Dance का मतलब है DID. What is DID? DID is dysmenorrhea, infertility. I'll tell you why there is infertility also, and dyspareunia. Okay, dyspareunia means pain. Yes, dysgeusia can also mean pain during sexual activity. Dyspareunia, painful sex. Okay, dysmenorrhea, infertility, dyspareunia. Now, why infertility? Please pay attention, because all this volcano every month. So please understand, 25 days of the month, everything okay. Whenever the patient will get menses, this volcano will erupt. And blood, blood is irritant to the pelvis. So there's going to be a lot of fibrosis and adhesions. So inside the pelvis, we'll see all these are adhesions. So the tube is pulled this side, ovary is pulled this side. So, and tubal problem classically, even ovulation could be defective, even implantation could be defective, but mainly it is the tubal peritoneal pathology and altered tubo-ovarian. मतलब क्या होता है, because of the adhesions, the tube will get pulled over here, and because of the adhesion, the ovary will get pulled over here. So the fimbria cannot pick up the egg. Okay, is this understood to all of you? And one more thing, please understand this, that normally the uterus is anteverted. We'll discuss this in prolapse also. Normally the uterus is anteverted. Okay, anteverted with the bend. What is it? All that I'm writing UB matlab urinary bladder. Okay, so normally this is the urinary bladder, this is the uterus like this. But in endometriosis, I told you lots of adhesions. So all the adhesions are going to pull the uterus backward. In the pouch of Douglas, there's lot of adhesions. Okay, pouch of Douglas में सब adhesions होगा. Okay, pouch of Douglas में सब adhesions होता है. We told you pouch of Douglas. Okay, so in the pouch of Douglas, all the adhesions take place. and therefore what will happen? Anybody? The uterus will become retroverted. The uterus will become, instead of like this, the uterus will become retroverted. Okay, so the uterus becomes retroverted because of all the adhesions. Yes, and it cannot move, therefore it is called as fixed. Why? Because of the adhesions. Okay, so it is called as fixed retroverted uterus with adhesions. Okay, so please keep this in mind. Fixed retroverted uterus, nodulite in the pouch of Douglas. That's a classical PV finding. When I do PV examination, uterus becomes retroverted. Okay, now seeing is believing. Anybody? What is the investigation of choice, or what is the best investigation for endometriosis? How will I know that the patient is having endometriosis? यस नो बेटा नॉट संगीता हिस्ट्रोस्कोपी आपको बता देंगे कैसे करना है एचएसजी में बेटा लैप्रोस्कोप आई कांट रीड योर नेम पीवी हाँ क्लासिक पीवी फाइंडिंग बेटा ये ओके क्लासिक पीवी फाइंडिंग रेट्रोवर्टेड यूट्रस because of the adhesion the uterus becomes retroverted and then nodular you can feel the nodules in the pouch of the Douglas. Okay, yes, seeing is believing. No beta mala, sonography can be normal also because sonography will at the most see chocolate cyst, but sonography can also be normal. And therefore remember my dear student, laparoscopy is the investigation of choice. Okay, laparoscopy, seeing is believing. Yes, it's a previous year question. And now all of you pay attention. What is laparoscopy? Total confusion. Today before the end of the day, you will become champion in what is laparoscopy and what is hysteroscopy. So laparoscopy may we put a telescope into the anterior abdominal wall. Through the anterior abdominal wall, we put a telescope to have a look at the pelvis. Yes, outside of the uterus and the pelvis. So this is laparoscopy. And normally all of you pay attention. क्या दिखता है? Sir, you see the uterus like this. I've shown you laparoscopy pictures. I'll show you more. Then you will see the fallopian tube. Yes or no? Yes. Imagine अगर आप पेट के अंदर टेलीस्कोप डालते हो तो क्या क्या दिखेगा? Okay, you will see the tube, you will see the ovary, you will see the uterosacral ligament. All this is pouch of Douglas. Okay, now laparoscopy में क्या होगा? एंडोमेट्रियोसिस में सर पहले दिखेगा हमको चॉकलेट सिस्ट. तो पूरा ओवरी के अंदर ऐसा ब्राउनिश 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 ब्लैकिश कलर का चॉकलेट सिस्ट दिखेगा. ओके, यस और नो? देयर वुड बी adhesions between the tube and the ovary as I told you. At rest क्या याद रखना है? फ्रूट सैलेड. फ्रूट सैलेड मतलब रेड रास्पबेरी, पर्पल रास्पबेरी, ब्लूबेरी. Okay, so like this we get beautiful, it's a colorful picture. You will get this red color. These are all called as implants of endometriosis, implants or lesion. So fruit salad, clap if you have learned something new. Red color lesion, पर्पल कलर, रेड, पर्पल और एक कौन सा कलर का है फेवरेट आपका? और क्या बोलते हैं? समथिंग डू विद गन. गन का क्या है? गन. सो ऐसे ब्लूबेरी एंड पाउडर बर्न स्पॉट्स या मैचस्टिक बर्न. मतलब मैचस्टिक आप ले लोगे और उसको एक्सटिंग्विश करने के बाद इफ यू पुट black on a paper you get very good, we get black color. Okay, so like this black color spots you will get. So if this is the picture, yes, gun powder burnt appearance or gunshot appearance or matchstick burnt spots. Okay, is this understood to all of you? पूरा याद नहीं रखना है. Even if you remember chocolate cyst, powder burnt spots or matchstick burnt spots are the same as the black color spots. And of course, if you remember adhesions, that is more than enough. And बाकी है आपका fruit salad, blueberry, red raspberry, purple raspberry, red lesion, white lesion, सब ये सब खून, ये सब अलग अलग खून के कितने रंग. नेम ऑफ द मूवी क्या है? खून के कितने रंग. Endometrium, मतलब अलग अलग कलर. And clap if you feel happy. Seeing is believing. Again for the first time, this is the ovary. And उसमें से can you see this typical? This year NEET PG MCQ. Clap if you feel happy. Okay. Yes. Okay. Now all of you pay. So this is what? So this is the chocolate cyst. Okay. Now all of you pay attention. This is what uterus. Can you see? Can you appreciate all these adhesions? Yes. And can all of you see this bluish nodule over here? Yes. तो ये जो है bluish nodule, zoom करके भी बता देंगे. Can you see this? Yes. Okay. So can all of you see this very beautiful bluish nodule? Yes. This is that blue color का nodule. Okay, blue color. And ऐसा blue, and can you see all these black spots I'm drawing? Okay, so like can you see these black spots are also. So like that we will get different color के spots. All these are called as nodules of endometriosis. So you can get a red color lesion, you can get a blue color lesion, you can get a purplish bluish color lesion and blackish color lesion. Okay, so all these are the different findings, extremely important. Do not forget, आपको साथ में वो लोग 100% DID देंगे कि सर the patient has symptoms of DID. DID क्या है? Dysmenorrhea, infertility, dyspareunia. Okay. Now very good Mazul. अब very good सोनोग्राफी में, सोनोग्राफी पे ये all these adhesions नहीं दिखेगा, पाउडर बन मैचस्टिक बन नहीं दिखेगा, ये नहीं दिखेगा. सोनोग्राफी पे खाली दिखेगा chocolate cyst. Okay, chocolate cyst is the only thing which you may pick up on ultrasonography. But ultrasonography can also be normal in endometriosis. क्योंकि अगर chocolate cyst नहीं है लेकिन बाकी ये सब चीजें हैं, ये सब चीजें जो हैं वो you need to see. That's why with laparoscopy you need to see. Is this understood, Masood? Very good question. Okay, sir, out of all the things, only the chocolate cyst you can see on ultrasonography. Rest common sense है ना. A matchstick burnt spot, purple spot, red spot, blue spot, सब कैसे दिखेगा सोनोग्राफी पे? Adhesions वो सब नहीं दिखेगा. Okay. And the advantage today, anybody? Now, if I see this, तो खाली ये देखेंगे कि क्या करेंगे? Advantage of laparoscopy: see and treat. Simultaneously we can do the corrective treatment, we can do the surgery. क्या surgery कर सकते हैं all of you? Dysmenorrhea, sir, most of the time it is present in almost all cycle. It will be there in every cycle. Normal patients में नहीं होगा. Yes, normally there's a difference between mild dysmenorrhea, there's very severe dysmenorrhea. Okay, and दूसरा चीज, one more thing about this DID, I don't like this word, लेकिन बुक में कभी कभी दिया है कि ये जो dysmenorrhea होता है ना, is for few days, dysmenorrhea is for few days before the periods also, and during periods also, and sometimes even afterwards also. So some books call it as triple dysmenorrhea. Okay, triple dysmenorrhea. Okay, 3 pain before, during, and after. Yes, common sense expert. None of you are doing surgery, लेकिन सबने बोल दिया कि सर ये adhesions को break करेंगे, of course chocolate cyst को निकाल देंगे, cystectomy, and ये जितना भी endometriotic spots है, blue, brown, red, black, we will go and we will burn them. जला के राख कर दूंगा साला. Okay, so we go and burn them, and that is the surgery. Clap if you feel happy. Okay, sir, for patients of infertility, removing the chocolate cyst, going for adhesiolysis, and burning all the endometriotic implant is the best choice. When the family is complete and severe pain, tabhi we can think of removing the hysterectomy, tube, uterus, ovary. That's the final treatment. But mainly this is infertile patient, so we prefer laparoscopic surgery, chocolate cyst removal, and endometriotic implants. The last part of this is, anybody, what word I told you to remember in endometriosis? In endometriosis, what word I told you to remember? Remember what? Endometriosis, volcano. Volcano का मतलब क्या है कि सर, only when the patient gets the periods, these endometriotic spots will, yes, functional endometrium, very good Abdul, it's a functional endometrium and it's a volcano. Only when the patient gets period, ये volcano erupt होगा. तो common sense कि सर अगर यहाँ से menses बंद हो जाएगा तो ये volcano भी नहीं फटेगा, ज्वाला नहीं फटेगा. Okay, लावा नहीं फटेगा. सेम थिंग कि सर, if I am able to suppress the periods, if we are able to suppress the periods of the patient, if I suppress or stop the periods of the patient, then the endometriosis will become better. Do you agree with me or not? Yes. के मीन्स अगर हमने पीरियड्स को ही बंद कर दिया तो क्या लॉजिक है? इट्स लाइक अ वोल्केनो. कि सर सपोज इफ अ वोल्केनो डज नॉट इरप्ट फॉर 20 years, अगर कोई वोल्केनो है जो 5-10 साल नहीं फटा है लावा, तो वो क्या बोलेंगे? 100 साल सर उसका लावा ठंडा पड़ गया, इट्स बिकम अ डॉर्मेंट वोल्केनो. एंड देयरफॉर रिमेंबर कि सर व्हेन आई स्टॉप द पेशेंट्स पीरियड, एंडोमेट्रियोसिस का जो लीजन होता है वो सब ठंडा पड़ जाता है. व्हाई एंडोमेट्रियोसिस बिकम बेटर? बिकॉज व्हेन यू स्टॉप द पीरियड्स, all the endometriotic lesions, they become hypotrophy, मतलब उसका atrophy हो जाता है, and they become decidualized. Okay, मतलब उसको decidualization हो जाता है, and therefore endometriosis becomes better. मतलब कि after pregnancy also, almost 9 months of pregnancy and 3-4 months of breastfeeding, patient does not get periods for 4-5 months. So 1 year patient has no periods. So after pregnancy, endometriosis always improves, but the patient has infertility, she's not becoming pregnant. So what is the logic? Remember, a medical management is to prevent recurrence. I want to induce amenorrhea in the patient. Okay, all this is PG level, ये याद नहीं भी रखेंगे तो चलेगा, लेकिन remember कि surgery के बाद हम sometimes we give medical management to prevent recurrence. We can also do sandwich therapy. That means what? We can do sandwich approach. That means, sir, I can give medicines for some time. For medicines, we can give for 2-3 months. Then I can do the surgery. Then I can again give medicines for 2-3 months. So वो भी चलता है. That depends from patient to patient. बट जनरली सर्जरी फॉलोड बाय मेडिकल करते हैं, बट मेडिसिन पहले भी कर सकते हैं. सो इट्स आइदर अ सैंडविच अप्रोच, दैट डिपेंड्स. ओके, बट लॉजिक इज टू इंड्यूस amenorrhea. I want the patient's periods to stop. Again, don't worry my dear student, कल जब आपको कॉन्ट्रासेप्शन पढ़ाएंगे, ओसी पिल्स, डीएमपीए, मायरीना, ये सब क्या है, ये सब पिक्चर अभी बाकी है मेरे दोस्त. All this will be discussed in the upcoming lectures. Don't worry. Danazol only theoretically, practically we don't use. Practically not used. Okay. And GnRH analogs are one of the most commonly used drug in the medical management. All this will suppress the patient's periods. तो वो endometrial volcano नहीं फटेगा, patient will feel better. The symptoms will become better. Okay. Anything not understood, anything not clear? The last part, virgin MCQ, futuristic MCQ, Dynogest. It's a new drug. Dynogest is a new drug. Clap if you have learned something new. It is again a progesterone. And when you can give it long-term treatment for endometriosis, we can give it 2 milligram continuously. So continuously, if I give progesterone, क्या होगा? As I told you, it is going to cause hyperprogesterogenic state and hypoestrogenic, because continuous progesterone, it will cause atrophy of the endometriotic lesion. बात समझ में आ गया? It will cause recidulation and atrophy of the lesion. And that is why this amenorrhea, what I told you, lesions will become atrophy. When you induce amenorrhea in the patient, lesions become atrophy and endometriosis becomes better. Is this understood to all of you? So all this, my dear student, they will not ask you, but only for my love for the subject. Just remember that mainly I want to induce amenorrhea in the patient. Induce amenorrhea. Atrophy मतलब बेटा, atrophy आपको पैथोलॉजी बताएगा, shrink हो जाएगा. Shrink is atrophy. Okay? Hyperplasia, continuous growth. ठीक है? Atrophy मतलब the lesion will सिकुड़ जाता है. It will shrink. Okay? So basically आपको MCQ के लिए खाली याद रखना है. What is the MCQ, all of you? MCQ will only be this. चलो 2027 मतलब 3 साल के बाद 2027 में ये MCQ आएगा. Virgin MCQ. Dynogest is a new drug in management of prolapse, PCOS, endometriosis, CA cervix, all of the above. Chalo, anybody? Very good, very good. Okay, sir, Dynogest is a newer drug in management of endometriosis. बस उतना ही याद रखना है. Sir, Dynogest is a progesterone. Dynogest is a progesterone. It's a newer progesterone. Okay, not all of the above. Okay, it will, when give you continuously, it causes the atrophy of the lesion. Okay, is this understood to all of you? Okay, so this is, student, we will take a small break. How many minutes break? How much minute break? 7 minutes, 10 minutes, how much break? Okay, small break. So we have discussed the basics of the HPO axis, LH surge, all that, anovulation, PCOS, and I can guarantee you 2 to 3 marks already in the pocket. And laparoscopy, hysteroscopy और अभी discuss करेंगे. Don't worry, picture अभी बाकी है. Laparoscopy का findings क्या ये करेंगे. And keep this in mind, 5 star. Please, this is very important. Laparoscopy image and this also is a very famous MCQ 5 star. Okay, yes, okay, fine. Chalo, 10 minutes break, 10 to 11 minutes break, not 15 थोड़ा ज़्यादा हो जाएगा दफा या फिर okay, yes. So 10 to 12 minutes break is 11:48. We can start at 12 o'clock. Yes, perfect. Okay, yes, 12 o'clock. Okay. I know this slide one more time. Yes, but I know this slide one more time. Okay. I know this slide. Okay. So this is very, very important new drug, recent advances. Everything will be taught to you. It is a break for 10 minutes. When we come back, we continue further. Okay. Hello, hello, hello. So welcome back, students. Quickly settle down. We're starting in a minute. So ready, students? Can all of you quickly settle down? We are starting now. Okay, yes. So just a quick recap. We have discussed very important HPO axis. We have discussed infertility, ka first two topics, PCOS, endometriosis. Now, extremely important male factor we are discussing now after some time. Moving on to the test for tubal patency. All this we are discussing in some time. Now, anybody, what is the meaning of tubal patency test? Okay, very important. If I tell you tests for tubal patency, very important MCQ. All of you, I want you to answer in the Telegram only, as I have put that I will not be able to see the chat in the app. So please use this Telegram group only. We have got 146 members in the group. If anyone who is seeing the video lecture now but not yet in the Telegram group, quickly join the Telegram group. Okay, is this understood to all of you? So if I tell you test for tubal patency are all except, which of the following HSG Yeah, the dye test, all that we will discuss. What is the dye test? Chalo, tell me the answer. All are test for tubal patency except A, B, C, D. हाँ HSG का इसमें से बताइए आंसर. All are test for tubal patency except all except HSG, my dear student, is one of the most. It's the first test. It is always the first test, or considered by many as the initial test. Okay, yes, except. Please read the question correctly. Very good. Okay, so see, this is how the students make a mistake. They are not reading the word except. Yes. Okay. So why hysteroscopy is the answer? Hysteroscopy क्या है? Laparoscopy क्या है? All you are going to become expert in the next 20-30 minutes. Is this understood to all of you, my dear students? I will explain to you in detail. But hysteroscopy is not for tubal patency. Hysteroscopy is to see the cavity of the uterus. Okay, we are going to see the cavity of the uterus with the hysteroscopy and not the tubal patent and not the tubal patency. How all that I will tell you. Now, anybody, what is this HSG? Hysterosalpingo Hysterosalpingography. It is what? It is a contrast X-ray. It is a X-ray with a contrast material. First question, which day of the cycle? Okay, so all MCQ, which day of the cycle do we do the HSG? Day 2 to day 3, day 10, day 14 to day 16, day 21 to day 25. Chalo. Anybody? When is the HSG done? Very important MCQ. Yes. Why not do it? So day 2, day 3, still the menses are on. Isn't it? Menses are still on. You can't push the dye. It will go retrograde and cause all complication. Okay, day 14, this is X-ray. I don't want to expose the ovum to the radiation. Day 14, this is the time of ovulation. And why never? Anybody? Why never on day 21 to day 25? Why never on day 21 to day 25? Yes. Why never on day 21 to day 25? Tell me. So the answer over here is day 7 to day 10. Traditionally, remember, we call it as day 8 or day 9. Okay, why? मतलब कि after 4-5 days the bleeding is over. When the bleeding gets over, उसके बाद we will. Yes, sir, why never on day 21? Because patient could be pregnant, isn't it? Imagine के 21st डे पे इम्प्लांटेशन हो गया या प्रोजेस्टेरॉन स्टार्टेड टू शटिंग डाउन बट दैट इज ओके. रजब, द इंपॉर्टेंट पॉइंट इज दैट सर 14 डे ओव्यूलेशन, 21st 22nd डे implantation, and patient is already pregnant. Okay, and imagine the problem. She is infertile patient trying to conceive. She has conceived. You are pushing the dye and taking X-ray. You will damage the pregnancy. So patient could be pregnant on day 21. Isn't it? 5 thumbs up if you have. Yes, very good, Abdul. 5 thumbs up if you have learned something new. So therefore, never ever do any procedure like a DNC or HSG on day 21 to day 25 because the patient could be pregnant. So याद रखेंगे, day 8 to day 9 is the time when we do the HSG. Is this understood to all of you? अभी HSG में क्या होता है? All of you look on the board. I'll show the actual picture. I'll show the instruments also. So this is the uterus. It looks like a triangle cavity, and there is the instrument. Okay, this is the instrument जो हम अंदर डाई इंजेक्ट करते हैं. Actual instrument also I will show you. This is called as what? Anybody? What is this kind of an instrument which is like a conical, like a cone, and उसको ऐसा serrations होता है, and it is like this, and from this side you will inject the dye. Okay, not the sound बेटा, not the sound. यहाँ से dye निकलेगा. This ऐसा, इसको बोलते हैं. Anybody? Leach Wilkinson cannula or Colvin's cannula. Don't worry, actual इमेज भी आपको दिखाएंगे. Okay, now what is this? So the triangle dye, a triangle uterus, then the dye will enter the fallopian tube, dye will enter the fallopian tube, and the dye will fall in the pelvis. So what is this called if the dye falls in the pelvis? This is called as the spill of the dye. Many students told me, sir, spill is abnormal. No, spill matlab normal. So the whole uterus will get opacified. Whole uterus will get opacified with the dye, but it will look white in color. Okay, and the dye what I put, okay, contrast urographin dye, okay, और कॉन्ड्रे डाई जो होता है वो हम डालते हैं. Okay, and the dye will fall in the pelvis. This is the spill of the dye. Again, clap if you feel happy. Seeing is believing. Okay, so all of you please look over here. All of you please look over here. Can you see this? Yes. This instrument, what I was telling you, can you see the serrations? This is that Leach Wilkinson cannula. And can all of you see this? This is the uterus. Is your triangle part hai. Then can you see one fallopian tube? Then another fallopian tube, right left marking, and then can you see all this crescents? ये जो moon जैसा होता है ना, crescentic moon. I'll show you and show. Okay, all this is the spill of the dye. Okay, so this is the uterus, this is the fallopian tube, this and this, and you can see over here. Can you see all this? So nice. Okay, bouncy wavy tube, just like a wow. Okay, and then we can see all this spill. तो इसको बोलते हैं spill of the dye. Okay, so therefore this is a normal HSG. Why normal HSG? Because sir, the uterus okay, and this instrument, my dear student, this what I am telling you, this is the Leach Wilkinson cannula. Okay, now by the way, HSG का क्या है? It can tell you the side and the site of the block. So please understand, आपके level पे till now only always a normal HSG has been asked in the exam. This question has come. Identify this image and identify what it is. Okay, so it is a hysterosalpingography. Now all of you tell me common sense. All of you tell me common sense. Is suppose if I draw like this and suppose all of you tell me, suppose if this is the uterus, and this, and I always write, and so now tell me the diagnosis. Okay, tell me the diagnosis. Right tube I am seeing only till here and it's a block. There's no further tube seen. And left tube I am seeing all the way over here and this. Now chalo, tell me the diagnosis, all of you. What do you think is the diagnosis over here? बेटा साइड भी इंपॉर्टेंट है, साइड. हाँ, वेरी गुड. मिड ट्यूबल ब्लॉक है, राइट साइडेड मिड ट्यूबल ब्लॉक, बट लेफ्ट ट्यूब नॉर्मल. Or we can also see is that this tube is blocked directly over here. This tube is again blocked over here. No spill. So both the tubes are blocked. Okay. So इस तरह से different. Don't worry. Again, when I take the image-based session, right now I am only showing you the. Right now I am only showing you the normal HSG. Normal HSG. Please keep in mind. This is the triangle uterus. This is the dye which you see, and all this what you see is the spill. abnormal HSG also, couple of them I will show you. Okay, don't worry. Yeah. Okay. नो बेटा एक्टॉपिक वी डोंट, बेटा एक्टॉपिक में हम नहीं करते हैं HSG. ओके एक्टॉपिक, हाँ वी आर गोइंग, वो बता रहे हैं बेटा. ओके सो दिस इज अ बायलैटरल ब्लॉक. सो नाउ अगेन द ट्यूबल ब्लॉक would be like a proximal tubal block, mid tubal block, femoral. Femoral block में क्या होगा, जो मुझे बोल रहा है ना, femoral block में क्या होगा, the dye will go all the way till the femora. ओके एंड फिम्ब्रिया में ब्लॉक है, फिम्ब्रिया में ब्लॉक है तो ट्यूब थोड़ा सा स्वेल भी हो जाता है, ट्यूब थोड़ा सा फैट हो जाता है, दैट इज हाइड्रोसल्पिंग्स एंड आई कैन सी द होल ट्यूब बट इट इज अ फिम्ब्रियल ब्लॉक. डोंट वरी, इन द infection classes all the hydrosalpinx, tobacco pouch, gallstick, all that I will show you. Okay, yes. And Dr. Sangeeta, very good. There could also be a condition where I have only the uterus is seen, दोनों साइड में ट्यूब में डाई एंटर ही नहीं होता है. सो यस, दिस इज अ कॉर्नुअल ब्लॉक. But now tell me, what will I do? Suppose the HSG में tube is blocked. Okay? HSG done, infertile couple, HSG showing that the tube is blocked. Again, I'm so happy. I teach every year and this year's NEET PG question. HSG tube is showing it is blocked. What next? What next? Anybody? IUI, IVF, चलो. नो बेटा राजा, व्हाट इज IUI? जब हम आपको सिखाएंगे आपको पता चल जाएगा. कंप्लीटली रॉन्ग. IUI के लिए ट्यूब्स हैव टू बी नॉर्मल. IUI is the most wrong answer. Don't worry. We are all here to make mistakes. Please, bindas, everybody write the answer. If somebody makes a mistake, it's absolutely fine. Better to be wrong over here than to be wrong in the examination. Very good, Cupcake. Please understand, my dear students, कि ये MCQ का लॉजिक ये है कि सर HSG is never confirmatory. HSG is not confirmatory test, isn't it? Okay, sir, if the HSG is showing that the tube is blocked, what next? I have to go and I have to confirm directly. There is no need to do IVF and IUI, and again no point repeating the HSG because again in this time there could the same problem can happen. Is this understood? Clap if you learned something new. What am I saying? ध्यान से सुनेंगे कि sir, while we are doing the HSG, the tube could either be genuinely blocked or also the tube can undergo spasm. Now anybody, can you tell me the difference between spasm and block? So spasm and block same picture आता है. All of you look on the board. All of you look on the board, and if you want a gold medal, and if somebody says this is the HSG, this is the HSG in front of you, so sir, इसमें only uterus is seen and the tube is not seen. Yes sir, this could be bilateral cornual block. Agreed. But it could also be a cornual spasm. And this is the disadvantage of HSG, that it cannot differentiate between a spasm and a block. Okay, it cannot differentiate between a spasm and a block. हाँ, तो very good. Okay, what is the difference between spasm and a block? Okay, sir, the block is fibrosis, adhesions. Block is pathological. Block is because of some fibrosis, adhesions, TB, whatever, infection, all that. But spasm is only a temporary. It is a temporary smooth muscle contraction. It's a smooth muscle spasm. Okay, it's a temporary muscle contraction kind of a thing, and the tube may appear to be blocked. Actually tube is normal. Yes, physiological. समझ में आ गया? Spasm could also be physiological. मतलब sometimes it is there and then it opens up. Okay, is this understood to all of you? So what is the meaning? That means what am I trying to tell you is that, sir, whenever HSG is the first test, but HSG is never a confirmatory test. Is this understood to all of you? 5 thumbs up, then I'll post it further. Because that means, sir, whenever HSG is showing any abnormality, you will have to go and confirm. And what is the confirmatory test? I will tell you in 2 minutes. Okay, so please understand this. When HSG, the tubes are blocked, do not jump in directly for IVF and surgery. We should confirm it by doing a laparoscopy. And what in laparoscopy? All that, because laparoscopy is the gold standard or confirmatory. Okay, वो भी आपको बताएंगे. तो पहले आपको याद रखना है, my dear students, there are 3 tests for tubal patency. HSG first मैंने बता दिया. Second is this, what is this? I will tell you in a minute. And third is the laparoscopy. Okay. So all these are the tests for tubal patency. Now anybody, इसमें क्या है? In HSG, it is a X-ray. It is a X-ray. Similarly, all of you please pay attention. Suppose if I take a USG, we take a USG picture, and during USG I will infuse saline. I will infuse saline. एक catheter लेते हैं. Small catheter is put inside the uterus through the cervix. Okay, through the cervix एक catheter डालते हैं और उसमें saline and air bubbles we push the saline. तो क्या होगा? So saline will go here, 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 here. Saline will go here, here, here. And saline क्या होगा? pelvis में गिरेगा. तो मतलब क्या है? अगर ये पानी पानी, and initially there is no fluid, and fluid will always appear black. I'll show you the fluid also. Okay, on sonography कैसे दिखता है. So if you see this fluid, what does it indicate? Anybody? Yes. Okay, sir, the tube is patent. Okay, sir, common sense. हमने जो saline, sir, हमने जो saline नीचे से inject किया, the saline went all the way up, and it came, and the saline fell in the pelvis. The saline I can see in the pelvis. So this, my dear student, is called as saline infusion sonography. Is this understood to all of you? Saline infusion sonography, also called as, matlab SIS, also called as sonosalpingography. Not routinely done, but yes, we are doing it. But again, इसमें left side, right side, all that, which side the block is there, all that थोड़ा difficult to find out, but it is a sonography. So one I can do a X-ray, one I can do a saline. Okay, now please pay attention. Okay, now please pay attention. Sir, during HSG, as you said, okay, sir, the tube can undergo a spasm. The disadvantage of HSG is that, sir, while we are, and that's why we take the patient, we call the patient by taking first antispasmodic. During HSG, the tube can undergo a spasm. So what can be done? Anybody? What is the, if I tell what is the best investigation for tubal patency? What is the best investigation for tubal patency? Or what is the gold standard? How do I confirm? तो क्या करेंगे? तो क्या करते हैं? Anybody? The same laparoscopy. Yes, the same laparoscopy which I taught you before the break. Laparoscopy में ये है uterus, ये है fallopian tube, and along with laparoscopy what I use? Anybody? What dye? What is the dye used? ये भी MCQ आया है last year. Laparoscopy में which is the dye what I inject, and then the name is ओके. यस, वेरी गुड डियर स्टूडेंट्स. तो ये देखो कैसे होता है. ये आपका डाई, ये आपका ट्यूब है. ओके, ये आपका ट्यूब है. यहाँ पे है ओवरी एंड यहाँ पे है दीज आर द यूट्रोसेक्रल लिगामेंट्स. नाउ व्हाट इज डन? व्हाट इज डन इज द असिस्टेंट. ओके, assistant आपने टेलीस्कोप, see this is the above view. Okay, this is a view from the terrace. Above view, this is a telescope. This is laparoscopy. I have put a laparoscope. Okay, and उसका pictorial representation यहाँ पे है. Okay, so we are seeing with a telescope the uterus tube. Now the assistant will take the blue color dye. Very good. The dye is methylene blue. Remember this MCQ. Very important MCQ. Those who are listening for the first time, please make a note. Very famous MCQ. तो क्या करते हैं? Assistant will push the dye through the cervix. तो क्या होगा? Dye will come up and tube के अंदर जाएगा, of course. And suppose if the tube is patent, तो क्या होगा? ये blue color dye बाहर गिरेगा. Same thing, the dye will enter the uterus and see. It is entering the fimbria tube and then coming out of the tube, and everybody starts jumping in the OT. Blue है पानी पानी, blue है पानी पानी, मतलब क्या? Blue color पानी पानी सब हो गया. Jumping. Why everybody start jumping? That the tube is patent. Thoko tali. And for first time ever, and this is the best investigation. Virgin MCQ surely coming in the future. Can you see all this blue color? बच्चा लोग ये सब दिख रहा है आपको? ये ब्लू कलर क्या है? ये ब्लू कलर है आपका मिथलीन ब्लू कलर डाई. ओके, दिस इज द यूट्रस. वी आर सीइंग ऑल फ्रॉम अबव. सेम पिक्चर. कैन यू सी? दिस इज द यूट्रस. दिस इज, सी, दिस इज द ट्यूब. दिस इज द ओवरी, white color, and this is, we have held the tube. This is the tube. And can you see this blue color dye coming? What is this? So this is the spill of the dye, spill of the methylene blue dye. Yes or no? Is this understood to all of you? Yes, is this understood to all of you? Can all of you see the uterus? Can all of you see the blue color dye coming out? Excellent. And this is the best investigation. Best bolo, gold standard bolo, confirmatory bolo. But of course it is never the, why is it never the first? Because of surgery. So directly I don't do surgery, because here I need to put in a telescope, surgery, operation theater, anesthesia complication, surgery complication. Okay, all that can happen. So whenever we see the uterus, from outside. We are doing the same laparoscopy which I told for endometriosis वगैरह, but at the same time we push the dye in the cervix. Okay, so laparoscopy के time पे we push the dye, which dye, in the cervix, and through the cervix we are pushing the dye and we are checking whether it is coming out of the fimbrial end or not. Is this understood to all of you? The dye is methylene blue dye and this will tell me that the tube is patent. Okay, तो दोनों साइड पे डाई आएगा ट्यूब में से और फिम्ब्रिया में से बाहर आएगा. This is the spill of the dye. Okay, and this is confirmatory, and therefore is this understood? 5-star MCQ, 100%. This is virgin MCQ till now in FMG exam. I'm teaching it since last 15 years. I'm teaching this MCQ. This came for the very first time recent 2024 NEET PG. And अभी 2 साल के बाद FMG में आएगा कि सर अगर HSG में ट्यूब ब्लॉक है, कंफर्म करना है थ्रू laparoscopy. So what are the 3 tests for tubal patency? Quickly in the chat box, can all of you type in the chat box? Yeah, beta, of course, na, the fimbria is open, na, there is a hole in the fimbria, na, to hi hoga na beta. Of course, the tube is patent. There is a hole, then how will the egg enter? Of course, there is a this na. Hole matlab itna bada hole nahi hota hai, but of course the fimbria is patent. So through the fimbria, you can see through the fimbria the dye is coming out. Okay, like this. Can you see this? See this. ये जो पूरा ना ये fimbrial end है. ये पूरा fimbria से dye बाहर आ रहा है. Very good. HSG, sonosalpingography, laparoscopy are the 3 tests for tubal patency. Now the last. Okay, and I'll show you this in a minute. Now all of you pay attention. And HSG may we get all the different results. Now suppose all of you look over here. Suppose this is the uterus. Okay, now this is the uterus. Inside the uterus, suppose there is inside the uterus there is a endometrial polyp, or there is a fibroid, or there is a adhesions inside the uterus. Anybody, what is this called as? Intrauterine adhesions. Any other name for it? Any other name? Or there is a septum. इसको बोलते हैं septate uterus. So this is a septum projecting in the cavity. So all these, yeah, Sinike, another name, very good, intrauterine adhesions or Sinike, and the another name for this is very good, Asherman syndrome. Okay, Asherman's syndrome, very famous MCQ. Please understand, my dear student, the adhesions between tube and the ovary is not called Asherman. Okay, तो ये जो आपको मैंने बताया था अपना अभी थोड़े टाइम पहले, these adhesions are not Asherman. Okay, I hope it is very clear. Inside the uterus, when there are adhesions, ये जो adhesions है, these adhesions are not Asherman. Okay, these are adhesions between the tube and the ovary. In the pouch of Douglas, there may be adhesions. Okay, that is not Asherman. Asherman specifically is a intrauterine adhesion. Now, can you tell me all these things, all this what I told you can cause infertility? Why this will cause infertility? All this can lead to infertility. How? What are the things? Yes, we are going to discuss that. Okay, Asherman syndrome, excessive curettage or T. Okay, so anybody, all this. So there could be a endometrial polyp, or there could be a submucosal fibroid. We'll discuss that, which fibroid. Okay, or there could be a septum, or there could be Asherman syndrome. How will this lead to infertility? How will this, yes sir, all this will prevent implantation. All this will, because all this is inside the uterus, so implantation will not take place. Isn't it? तो अभी क्या करते हैं, अभी क्या करेंगे, we take a telescope, and so this is the problem. They will have problem in the cavity. Anything to do in the cavity, we will cavity problem will prevent implantation. Yes, uterus itself is filled with abnormal stuff, so how will the pregnancy happen? तो अभी क्या करेंगे, yes, hysteroscopy. Like in laparoscopy, I put a telescope through the anterior abdominal wall. In hysteroscopy, I will put the telescope through the vagina. Through the patient's vagina, we will put a telescope into the cervix, and I see the inside of the uterus or the cavity. And all this problem which you see can be confirmed by the hysteroscopy. And yes, I can cut the pathology, all of you. I can cut the polyp, I can cut the fibroid, I can cut the septum, and I can break the adhesions. All of you look on the board. ये क्या हो रहा है, देखो सर्जरी हो रहा है. हिस्ट्रोस्कोपिक पॉलिप कट, हिस्ट्रोस्कोपिक फाइब्रॉइड कट, ठीक है, हिस्ट्रोस्कोपिक सेप्टम कट, ऐसा कट 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 कट. तो ये इसको बोलते हैं हिस्ट्रोस्कोपिक septal resection, and I will break the adhesions like this, which are this, that is hysteroscopic adhesiolysis. Thokotali, clap. Okay, so all the problems which are inside the uterus, hysteroscopic polypectomy, hysteroscopic myomectomy, hysteroscopic septal resection, hysteroscopic adhesiolysis can be done. Is this understood to all of you? So now if I tell you a MCQ, and then I'll explain to you between hysteroscopy. Is this understood to all of you? So hysteroscopy for all this is the best investigation or gold standard. Hysteroscopic surgery can be done for any problem in the cavity. Okay. So if the MCQ is, okay, what is the treatment for, say, Asherman's syndrome? MCQ, laparotomy and adhesiolysis. Adhesiolysis understood. Laparoscopy, hysteroscopy, all of the above. Yes, adhesiolysis है. Adhesiolysis तो understood है बेटा. The question is, how will I do the adhesiolysis? That is the MCQ. Laparotomy करेंगे, laparoscopy करोगे, hysteroscopy करोगे, कि all of the above? Clap, clap, clap. दिल पे हाथ रख के कहना, all these questions when you came today morning, you are not knowing, lifelong you will not forget, is my guarantee. Okay, sir, the logic is, okay, sir, Asherman syndrome is the intrauterine. It is intrauterine adhesions within the cavity. तो laparotomy करके कोई मतलब नहीं है. Laparoscopy, no point. The answer is yes. Hysteroscopy, adhesiolysis. Clap. Is this understood to all of you? Similarly, here you will say hysteroscopic polypectomy, polypectomy, hysteroscopic myomectomy, hysteroscopic septal resection, hysteroscopic septal. So again, septate uterus, what is it? Hysteroscopic septum resection. Okay. Yes. Okay. So now, Okay, so now all of you pay attention. Final thing that तो hysteroscopy and laparoscopy समझ में आ गया. And now I will tell you कि why. So this is it. Whenever you enter the cave, whenever you are seeing inside, see, this is very difficult. It's a PG level, but this is the cavity of the uterus. Similar, this is the cavity of the uterus. So we are seeing the inside of the uterus. This is the cornual end. The cornual end. Can you see this opening? Is the tubal opening. This is the opening of the tube. Okay. So this is the hysteroscopy picture. And now inside the uterus, as I told you, so there could be a polyp, there could be a fibroid, there could be all intrauterine adhesions, which I can cut with the hysteroscope. Okay, so hysteroscopy is to visualize the cavity of the uterus. And now can all of you tell me this MCQ का answer अभी समझ में आ गया कि why hysteroscopy is not for tubal patency? Yeah, both are normal, correct, the picture. Yes, why hysteroscopy is not for tubal patency? Because all of you look over here. Okay, sir, in hysteroscopy, I will put the telescope only inside the uterus cervix, and I will only be able to see the cornual part of the tube, isn't it? Yes. Okay, sir, Harsha, के हिस्ट्रोस्कोपी और कैविटी बराबर है, बट कैविटी एंड कैविटी के साथ और क्या दिखेगा सर? आई विल सी द cornual end, and you only tell me, yes, so we will see the cavity of the uterus. Hysteroscopy, we will see the cavity of the uterus and I will see the cornual opening. But now you tell me, sir, suppose the cornu is open. Suppose the cornu is open, can I comment if the tube is open or not? If the cornu is open, can I say the tube is patent? No, sir. Sir, tube mein block could be here, block could be here, block could be here, block could be here. All this we cannot see. We cannot see with hysteroscopy. समझ में आ गया बच्चा लोग? Yes. That is why, sir, hysteroscopy में to confirm the tubal patency and to see the full length of the tube, ब्लॉक यहाँ पे होगा, यहाँ पे होगा, यहाँ पे होगा, तो वो हिस्ट्रोस्कोपी पे नहीं दिखेगा. Is this understood to all of you? And therefore you should know this 2 MCQs perfectly fine, that hysteroscopy, because hysteroscopy can only see the cavity of the uterus and hysteroscopy cannot see the full tube. Okay. Hysteroscopy cannot see the full tube. Hysteroscopy can only see the cavity. Yes, distal tube, proximal tube, femoral block, all that only laparoscopy can. Laparoscopy sees the whole tube. Common sense, yes or no? Yes. Okay. Just a minute, sure. Yes. Now tell me one more thing. Okay. So hysteroscopy, laparoscopy का basic idea आपको आ गया है. Now lifelong you will not forget. I'll make you expert in the condition topic is that students get totally confusion. कि laparoscopy क्या है? This is the laparoscopy. Whenever we see the actual uterus, we see the fallopian tube, we see the ovary, we see this whole fallopian tube, isn't it? So all this is laparoscopy. अगर हमने सेम टाइम पे मिथिलीन ब्लू डाई डाल दिया, सो इट इज कॉल्ड एज क्रोमोपर्ट्यूबेशन. ओके, आई टोल्ड यू क्रोमोपर्ट्यूबेशन मतलब के क्रोमो मतलब कलर, क्रोमो मतलब कलर to put in the tube, and that is with the help of a methylene blue dye. So laparoscopy, chromoscope. And in hysteroscopy we are putting the telescope inside the cervix to see the cavity of the uterus. Okay, so lifelong clap if you feel happy, you will not forget. कैसे याद रखना है, मेरा जो स्पेशलिटी है कि if all of us are in one classroom, I am inside the classroom, I am seeing all of you, that means inside the classroom view. Now common sense, wherever you are sitting, wherever you are sitting from your place, can you see who is standing on the terrace of the building? No sir, because you cannot see outside the classroom. But if I go on the terrace of the building, from the terrace of the building I can see the road and the car from outside, but I cannot see how many students are inside the classroom. Is this understood to all of you? तो कहने का मतलब ये है my dear student कि laparoscopy is a terrace view. Clap if you feel happy. So sir, in laparoscopy I am putting a telescope through the anterior abdominal wall. So I will see the uterus ka outer surface, isn't it? I will see the fallopian tubes, I will see the ovary, but I cannot see whether the inside the uterus अंदर adhesion है, polyp है, fibroid है, अंदर कचरा भरा है कि cavity normal है, वो नहीं दिखेगा. वाइस वर्सा अगर हम टेलीस्कोप यहाँ पे डालेंगे और ये है L, ये है H, तो अगर हम हिस्ट्रोस्कोपी डालेंगे तो हिस्ट्रोस्कोपी से हमको खाली पता चलेगा कि सर कैविटी इज क्लीन, कैविटी इज क्लीन और कैविटी के अंदर प्रॉब्लम है. लेकिन यूट्रस के बाहर if there are adhesions between tube and the ovary, if there is chocolate cyst in the ovary, whether the tube is patent or not, वो हिस्ट्रोस्कोपी में नहीं पता चलेगा, वो खाली लैप्रोस्कोपी में पता चलेगा. Is this understood to all of you? So logical है ना? Again now all of you look over here. This picture, suppose I tell you, suppose I show you this picture. Can you see tube, uterus, ovary? Yes. So this is laparoscopy. Now you only tell me, can I say inside the uterus is normal or not? Can I find out inside the uterus, sir, whether this uterus is having septum or not? Can I find out? No, because I'm seeing only the outside. Can you tell me inside the uterus, is this having Asherman or not? Asherman, yes or no? So nahi, sorry sir, I cannot come to. That's why student ask me, okay sir, like who is better, hysteroscopy, laparoscopy? No, it depends on, sir, Shah Rukh Khan, Amir Khan, kaun better? No, both are very good, kings, but depends on the indication. Okay. सिमिलरली अगर आपको ये लैप्रोस्कोपी का पिक्चर बताया और ये हिस्ट्रोस्कोपी का पिक्चर बताया, अभी बोलो कि ट्यूब कैसा है, नहीं पता चलेगा. मुझे बताओ यूट्रस के बाहर फाइब्रॉइड है, सॉरी सर, बिकॉज आई एम लुकिंग ओनली एट द कैविटी, आई एम सीइंग इनसाइड. सो इनसाइड द क्लासरूम आई कैन नॉट सी हु इज ऑन द टेरेस. From the terrace I cannot see who is inside the classroom. Is this understood, Thokotali? Okay, so that is why my dear students, it depends on the, so this picture should be framed in your mind, and if I'm so happy I'll tell you this also. So now tell me this, okay, and therefore many times we combine histolaparoscopy, and therefore now tell me this MCQ also. That is why what I told you over here, ये जो हमने MCQ सिखाया था आपको कि अगर ये आशरमैन सिंड्रोम है तो नो पॉइंट डूइंग लैप्रोस्कोपी एंड लैप्रोटोमी, इट हैज टू बी अ हिस्ट्रोस्कोपिक एडिजियोलाइसिस. और फॉर दैट मैटर इवन फॉर सेप्टेट यूट्रस, for septate uterus also. Anybody wants the answer? How do I treat septate uterus? Tell me the treatment for septate uterus. Hysteroscopic cutting of the septum or laparoscopic cutting of the septum? Septum is a projection coming in the cavity. hysteroscopic septal resection. तालियां बजते रहनी चाहिए. Clap for yourself. Okay. Yes. Okay. So all of you, please pay attention. Now, final thing, whether you have understood the thing or not, whether you have understood the thing or not, finally, is now when we play the game. गेम क्या है कि मैं आपको कंडीशन बताऊंगा, आपको चैट बॉक्स में खाली लिखना है H और L. If you feel laparoscopy is the answer, type L. If you feel hysteroscopy is the answer, type H. Ready? Okay, all of you. Okay, all of you ready? So you will play the game. We will play the game H and L. Okay, which instrument or which investigation say which I will see the chocolate cyst. Chocolate cyst. Excellent. Yes sir, chocolate cyst है, very good. Or if I want to see a subserosal fibroids हम डिस्कस करेंगे, लेकिन ये बाहर वाला फाइब्रॉइड, दिस इज कॉल्ड अ सबसीरोजल फाइब्रॉइड. सबसीरोजल फाइब्रॉइड. यस सर, फाइब्रॉइड बाहर की तरफ, सबसीरोजल बाहर की तरफ, लैप्रोस्कोपी सबसीरोजल. ओके, सब म्यूकोजल नहीं बोला है. नाउ which condition I will see adhesions between the tube and the ovary. Adhesions between tube and the ovary. Laparoscopy. Which condition I will see, and which instrument I will see endometriosis. Laparoscopy. Now, which I will see tubal patency, laparoscopy. Which I will see the tube, which I will see the pelvis, pouch of the, all laparoscopy. Now, which investigation I will see septum, septate uterus. Septate uterus कैसे पता चलेगा? Yes sir. Now आपको टेलीस्कोप अंदर डालना पड़ेगा, हिस्टेरोस्कोप. Now सबम्यूकोजल फाइब्रॉइड, इसको क्या बोलते हैं? कैविटी के अंदर. देखो पिक्चर से देखो, ये कैविटी के अंदर है, इसको बोलते हैं सब म्यूकोजल फाइब्रॉइड. यस, सो बात समझ में आ गया, दोनों फाइब्रॉइड है. क्लियर सर, ये बाहर वाला फाइब्रॉइड है तो उसके लिए दिखेगा, लगेगा लैप्रोस्कोपी. ये अंदर वाला फाइब्रॉइड है तो वो हिस्टेरोस्कोपी से दिखेगा. सिमिलरली ऑल ऑफ यू नो, पॉलिप है या इंट्रा यूट्राइन एडिशंस है, all that the answer is hysteroscopy. Clap. Okay, so my guarantee lifelong. I went to a conference in Mumbai and I met a student who had attended my classes 7-8 years back, 10 years back, PG के लिए, and now he has become he was in chest medicine or he was doing a physician, and he said that sir, I remember आपका hysteroscopy, laparoscopy after 10 years also, okay, terrace view and inside the classroom. Nobody will teach you like this, is my guarantee. Okay, so अभी lifelong mistake मत करना. hysteroscopy, laparoscopy indications are different and therefore laparoscopy से हमको tubal patency test पता चलता है. hysteroscopy is only to visualize the cavity of the uterus. Okay, I hope this is absolutely crystal clear. Okay, and hysteroscopic I also do the surgery of all the conditions, septum and all that we can break. Okay, the next is the semen analysis, the male factor. Anybody, what is the normal sperm count? What is the normal sperm count? Okay, so please understand this. First I am showing you the old so that you know what is the new. Please don't remember this. This is the old criteria, old. Okay, and therefore actually आपको याद नहीं रखना है. नहीं नहीं बेटा, अरे 2 million तो बहुत कम हो गया. Okay, 5 million 9 में बहुत कम है. Okay, so the old criteria was, but as I said, this is old criteria. So at least 20 million per ml was the count. 50% sperms should have a forward motility and 30% sperm should be morphologically normal. ये था old criteria. Now the WHO has made the changes, and now you're coming. Okay, so 15 million per ml is what you should remember actually. Okay, and 40% should be the motility and only 4% sperm should be morphologically normal. तो प्लीज अंडरस्टैंड, आपको जो पुराने फिगर्स थे 20, 50, 30 is replaced by now 15, 44. And very latest, very good Chitranjan, Dr. Bin, okay, now even this 15 million has been made, just ये WHO time pass करता रहता है, 15, 16, all that time pass, okay, has been made into 16 million per ml. Okay, so I don't think कि आपको ऑप्शन में 15, 16 दोनों देंगे, but if both are in the option, please mark 16 million per ml as the latest answer. Okay, even the motility now, instead of 40 they say 42%. Morphology is same, 4% sperms are morphologically normal. Morphology matlab only one head and one tail. Okay, morphology normal matlab ke sir there should be only one head and one tail. तो मॉर्फोलॉजी गड़बड़ मतलब क्या है? डबल हेड. डबल हेड. स्पर्म इज कंफ्यूज, वेयर डू आई गो? एक हेड को इधर जाना है, एक हेड को इधर जाना है, स्पर्म कंफ्यूज है. या डबल टेल, एक टेल इधर पुश कर रहा है, एक टेल इधर पुश कर रहा है, स्पर्म उधर ही राउंड राउंड घूम रहा है. ओके, एब्सेंट टेल, एब्सेंट हेड, ये सब होता है. ओके, ये सब एबनॉर्मल फॉर्म्स है. ओके, सो now what is the difference between aspermia and azoospermia? Sperm absent in azoospermia, semen absent, aspermia absent, zero sperm, complete azo no. Okay, no sperm or no semen. Very good. Okay, so please understand this. There is a lot of confusion among the students. Don't make a mistake. When there is nothing coming out, when the patient is ejaculating, nothing is coming out, that is aspermia. But if the semen comes out, but inside when I put under the microscope there is zero sperm count, that is azoospermia. Okay, less count को क्या बोलेंगे? Oligospermia. Oligospermia मतलब the count is less. इफ द स्पीड इज लेस, धीरे धीरे चलने वाले स्पर्म को क्या बोलेंगे? एस्थेनोस्पर्मिया. Asthenospermia. And when the morphology is bad, we use the word teratospermia. Okay, so very, very important 5-star slide. Please by heart this, that sir, aspermia is absence of semen, but azoospermia is a zero sperm count. Okay, whereas asthenospermia मतलब के the motility is less, and when the count is less we use the word oligospermia. And now all of us know कि 15 million के बदले 16 million per ml याद रखना है. Okay, because still 16 million is okay. Okay, so all this 15 16, but if they want to ask they can ask. Okay, sperm count less than dash million per ml is now called oligospermia, and 15 and 16 both are in the option. Better to mark 16 as the answer. Okay, this is some purposeful issue. And when I told you only 4% sperm should be normal, right? 4% should be normal. So when more than 96% are abnormal, we call it as teratospermia. Okay, we call it as teratospermia. Okay. Now, the male factor, now very important, please pay attention. So these are the basic things. Now, very, very important, the male factor infertility, the causes could be pre-testicular, testicular, post-testicular. इसका मतलब क्या है? What is the meaning of pre-testicular, testicular, post-testicular? इसका मतलब ये है कि pre-testicular मतलब something is wrong with the master. Master himself is sleeping. Something is wrong with the hypothalamus and pituitary. It means a hypothalamic failure, pituitary failure. Okay, that means what? One of the example is anybody Kalman syndrome. चलो फार्मैक माइक्रोबा अपना सॉरी मेडिसिन में भी सिखाएंगे फिजियोलॉजी या योर इवन माइक्रोपैथो. Kalman syndrome. What is Kalman syndrome? Why I have kept it in pre-testicular pathology? But why is it effortless? So Kalman syndrome में the problem is with the hypothalamus. Hypothalamus problem है. There is GnRH deficiency. Gonadotropin releasing hormone GnRH जो hypothalamus में आता है, that will be less. So of course FSH will be less. So it is, and along with it, what is the popular problem? Anosmia, sense of smell. ये MCQ आया है, ठीक है. GnRH deficiency along with anosmia, sense of smell. That is the Kalman's syndrome. Okay, so it is a problem with the master. The master could be normal, and now the problem with the testes. Okay, sir, actual testes ही खराब है, मतलब के testicular failure. मतलब क्यों? Trauma, torsion, heat, radiation, whatever bad things about the testes, orchitis, whatever bad things about the testes you can think. Is this understood to all of you? So trauma, torsion, heat, radiation, all that is your testicular failure, testicular causes. So again, इसमें संभाल के all those boys going for gymming, okay, steam bath, sauna bath, avoid too much heat down there, वरना body बन जाएगा लेकिन future में problem हो जाएगा. Okay, that's why the testes are outside the body. So keep it cool. Okay, so while studying, keep a ice pack over here, keep a ice pack over there also and study. So keep it cool, keep it cool. तो brain cool होगा तो अच्छे से याद रहेगा, testis cool होगा तो sperm भी अच्छा रहेगा. Okay, so keep it cool up also, keep it cool down also. Okay, so all the testicle, yes, Klinefelter syndrome also, all that come under testicular pathology. Okay, chromosomal problem, genetic problem, all that. Varicocele, very good. Varicocele also. Okay, orchitis. And lastly, sir, master is also okay. Sir, testis is actually okay. Lekin the sperms are not able to come out. The sperms are not able to come out. There is a block in the epididymis or the vas deferens, like your infection in the vas, obstruction in the vas. Very good. There is a condition called as congenital bilateral absent vas deferens. CBAVD, congenital bilateral absent vascular. Okay, so all this. Similarly, if a patient has developed a inguinal hernia and during that time the surgeon is not careful, okay, during the inguinal hernia repair, accidentally the vas deferens can get damaged. If the patient is very unlucky and again goes to the same doctor for surgery, then even the other side vas deferens can get blocked or ligated. Okay, so this is very, very important. Pre-testicular, testicular, post-testicular. 5-star slide, please by heart it. Like your example, Kallmann syndrome or idiopathic, varicocele, trauma, torsion, heat, radiation, undescended testes, again comes under testicular pathology. The testes heat would lead to, that's why testes are outside the body. Na? So the testes heat will lead to what? Beta, testes heat will lead to damage of the sperms. Okay, spermatogenesis will get affected. That is the reason why this varicocele and too much of heat, radiation can damage the capacity of the testis to produce the sperm. Okay, PK. And post testicular में obstruction like any infection or accidental damage to the vas deferens or bilateral absent vas deferens. Okay, is this understood to all of you? Now, if you are paying attention in the last 1 hour, please don't disappoint me. I will do only one blood test in the male. I will do only one blood test in the male and mystery खुल जाएगा, राज खुल जाएगा कि problem is in the pre-testicular area, testicular area or post-testicular area. Can anybody tell me? My question is, I will do only one blood test. Which one test report will tell me whether it is pre-testicular, testicular or post-testicular? Yes, sir. Okay, absolutely correct. Same master servant जो मैंने आपको फीमेल में बताया. Pituitary is the master, ovary is the servant. Same logic over here. Pituitary is the master, testes is the servant. So, sir, when it is a pre-testicular pathology, FSH itself will be very, very low, isn't it? Common sense. And that's why this is called as hypogonadotropin hypogonadism. समझ में आ गया? इसको क्यों बोलते हैं हाइपोगोनाडोट्रोपिक? हाइपोगोनाडोट्रोपिक का मतलब है कि सर FSH इज वेरी वेरी लो, इसलिए बोलते हैं hypogonadotropic. Yeah, no, please pay attention, you will understand. Now, can anybody tell me, like the ovary fail, जब ओवरी फेल होता है तो FSH क्या होता है, बढ़ता है. So similarly, if the testis is not producing sperms, what will happen to FSH? FSH will go very very high. And can anybody tell me what will be the FSH in post-testicular pathology? In post-testicular pathology, what happens to FSH? Okay, so sir, in post-testicular pathology, there is a block here or a block here or a block here, but the sperm production is normal. Do you agree with me? Yes, sir. And master is only bothered about sperm production. So since the sperm production is normal, the post-testicular post-testicular problem, the FSH would be normal. Yeah, we are showing the slide beta. Okay, and therefore please understand this is a 5-star thing which you will by heart this. Okay, okay, sir, FSH will tell you where is the problem. If the FSH is very very high, there is the problem testes. When the servant say, आपने क्या याद रखा, कुछ नहीं करना है, just replace ovary with testes. What did I say? What did I say? Those who are asking me to repeat, tell me the answer. When I said that when the ovaries will fail, when the ovaries will fail, that means the lady has reached menopause. Ovary is natural. What is happening to FSH? Tell me. Chalo. When the ovary fail and FSH patient reaches menopause, what happens to FSH? Tell me. High or low? Very good. FSH is high, 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 high. Same thing hai कि sir, when the testes have also, when the actual testes have been damaged, again FSH is going to be high. Okay, so sir, in the very high FSH agar hai, that means it is a fault of the servant. Yes, master will shout to increase. But agar master himself is sleeping, now tell me, अगर मास्टर ही सो रहा है तो FSH क्या होगा, very very low. Very low FSH indicates it is a master problem, and normal FSH indicates a post-testicular pathology. Is this understood to all of you now? Yes. And why in post-testicular pathology, the FSH is normal? Why normal? Because sir, in post-testicular pathology, the testes say the sperm is normal. The sperm production is normal. The sperm is not able to come out. समझा? इसलिए normal effect because testes में sperm. Is this understood to all of you? That's what I've drawn over here. Okay, sir, when there is a post-testicular pathology, post-testicular problem कहाँ पे है? So problem is in the after testes. Problem is in the vas deferens. Yes, but the sperm production तो अंदर चालू है, तो master is only bothered about sperm production. Yes, when the sperm production becomes less, when the sperm production becomes less, then the FSH will rise. Is this understood to all of you? When inside the testes, if the sperm production is becoming less, master will go high, high, high. Is this understood? कुछ बड़ा बात नहीं है. It's only the logic, and it is only the concept which you should get it correct. And therefore, please, my dear student, all of you, I repeat for the last time, whoever is asking me to repeat, okay, sir, how to differentiate where is the problem, whether it is master or servant? Common sense, servant का problem है तो master will be very high. एंड अगर मास्टर का प्रॉब्लम है हाइपोथैलामस और पिट्यूटरी, तो देन इट विल बी वेरी वेरी लो. हाँ, टेस्टोस्टेरॉन तो दोनों में एफएसएच कम हो तो टेस्टोस्टेरॉन प्रोडक्ट भी लो इन बोथ दिस एंड यस correct. That's why testosterone not the answer. Correct. So in pre-testicular also the testosterone goes down, and testicular problem also the testosterone goes down. Very good. Okay. But that is why this is called as hypogonadotropic hypogonadism, and यहाँ पे FSH is. Okay. So now tell me the answer. Okay. I want all of you, and normal FSH is a post-testing. Okay. Is this understood to all of you? So if I tell all of you that tell me the okay which condition FSA matlab now you tell me pre testicular, testicular, post testicular, which condition FSH is very very high? Very good, excellent, all of you. Which this is a in testicular father. Which condition FSH is very very low? We are talking of male, huh? Male. Yes, when sir hypothalamus or pituitary problem है, तो FSH is going to be very very low. And which condition the FSH is normal? FSH is normal. Post testicular FSH is normal. Okay, now all of you pay attention. The next 20 minutes, the next 10-15 minutes, whatever we are going to discuss now, it is never ever asked to the students, but may come in the future exams, and therefore I will discuss, and that is IUI, IVF and ICSI. Okay, now anybody, what is all this we'll discuss? IUI, IVF, ICSI. Anybody, IUI, IVF, anybody? First of all, IUI, IVF same or different? IUI and IVF is same or different? So what's the difference? IUI full form क्या है? So now please understand whatever next 10 minutes I'm going to talk is a complete virgin topic, never ever asked. Okay, different. What is the different? Completely different. Very good. क्या difference है? Different. Very good. Of course different. So what is the difference? Yes, IUI is intrauterine insemination, IVF in vitro fertilization. Okay, so now please pay attention. As I said, पहले IUI. Now IUI is mainly for the male factor. When the male patient sperm count is less, okay, and the speed is less. Okay, speed is less. So for oligospermia, asthenospermia, but kitna? See, more than 16 million per ml is normal. So if I have a male patient, जिसका sperm count है suppose 12 million per ml, 12 million, 10 million, 8 million, 11 million, 5 million, bus. So if I have a patient whose sperm count is low or the motility is also low, sperm motility is low. So sperm is not able to reach the tube. Again, the same thing we know, uterus, cervix, fallopian tube. Okay, egg आ गया यहाँ पे. And now please pay attention. Suppose if the sperm come over here, and then they cannot go to the top because the count is less, motility is less. So in IUI, what we do? In IUI, we take the semen sample of the male in the laboratory, we wash it, we prepare it. All the kachra I will remove. All the lula langda sperms I will remove. All the dead sperms I will remove. It is like World Cup cricket team selection. Okay, sir, we have a cricket team or hockey team or Olympic team or whichever. Okay, sir, we have got 30 best, 30 top players. Out of the 30, remove the faltu 15, and again remove, and then the best 15 or best 11 we send for World Cup. Same thing. Okay, so sir, this semen sample is washed in the laboratory, and then we bypass the cervix. We bypass the cervix, and with a small catheter, I will directly push the semen sample inside the uterus, which is IUI. Okay, so बहुत simple procedure है, just 5-6,000 rupees, not expensive also. So the semen is washed. Okay, the semen is washed, prepared मतलब उसको we charged up. So washed or processed or prepared semen is put inside the uterus. That's it. That is IUI. लेकिन अभी ध्यान से सुनेंगे सब लोग. From here the sperms have to go above inside the tube. Even the egg has to come from here, and therefore for IUI to be successful, my fallopian tube, my means the patient fallopian tubes, have to be normal. Do you agree with me or not? Yes, the tube has to be patent. Common sense. If the tube is blocked over here, IUI cannot be done, IUI should not be done. Is this understood to all of you? Yes, and very good. The egg is still inside the body only. You can see that is the main thing, that egg is inside the body. Egg and the sperm will meet inside the tube only, like a natural conception, and then the pregnancy will come to the uterus. Is this understood? 5 thumbs up. But all of you look on the board. Can you understand this point? Okay, sir, when we are doing IUI, the tubes have to be patent. समझ में आ गया कि tube will be patent, then only I can do IUI. If the tube is blocked over here, anywhere, if the tube is blocked, IUI cannot be done. आपके लेवल पे माय डियर स्टूडेंट्स, आपको एक ही याद रखना है कि फॉर IUI fallopian tube should be normal. At least one fallopian tube should be normal, and the count of the sperms should be at least between 5 to 15 million per ml. अगर ये दोनों कंडीशन है, 5 to 15 million per ml. Okay. Okay, 5 to 15 million per ml अगर sperm count है. हाँ बेटा, that is understood ना? Yes, common sense. Sultan and Harshvi, you only tell me. Very good, sir. Of course, on the day of ovulation, so it will depend 13, 14, 15, whenever the female can ovulate. Generally, is the 14th day. So common sense, ke sir, when will I do the IUI? Sir, on the day. It is around, not exactly same day, but the sperms can survive for 2-3 days. So just before ovulation or just after or on the day of ovulation. Correct. Sultan and Harsha, correct. Okay, sir, common sense. When the egg is in the tube, that time only I will do the IUI. Isn't it? So sir, जिस दिन ट्यूब में egg है, उस दिन हम IUI करते हैं. एक दिन पहले भी कर सकते हैं. So when the ovulation happens, ovulation हो गया, that day I will go for the IUI. Is this understood to all of you? Yes. Okay. But sperm count. Now where else? Please understand this, that certain condition there is anti-sperm antibody in the cervical mucus. The cervical mucus is damaging the sperms. So we are bypassing the cervix and putting the sperm directly inside the uterus. Okay. Or sir, the male has a problem. The count is 100 million. Okay, count कितना है? Example, suppose 100 million है. At the time of sex is not getting erection, erectile dysfunction, pressure, tension, anxiety, erectile dysfunction, या फिर penile deformity, epispedias, hypospedias. All that condition also I can do IUI. or there's a condition where the female contracts, they'll teach you in forensic psychiatry, the female contracts the thigh muscle, entry of sperm is not possible. All these conditions, IUI can also be tried. Is this understood to all of you? So please pay attention, very, very important point. Yes, sir, IUI is mainly for the male factor. If the count is somewhere between 5-10, as I said, आप याद रखो at least 10 million per ml तो होना चाहिए, 5 to 20 million, 5 to 15 million. Okay, if the sperm count is less than 5 million per ml, IUI is not effective. Okay, तो लेस देन 5 मिलियन है तो क्या करना है, पिक्चर अभी बाकी है मेरे दोस्त, 2 मिनट के बाद बताएंगे. देन anti-sperm antibody in cervical mucus, any penile deformity, epispedias, hypospedias, penile deformity, मतलब काउंट अच्छा है सर, काउंट 100 मिलियन है, act of sex not possible, vaginismus. And lastly, unexplained infertility. Unexplained, then again, when everything is normal, we don't know, we can try IUI. Last line, all of you, wherever you are seeing my lecture, in the home, hostel, movie theater, multiplex, please read the last 2 lines loudly. Patent fallopian tube is a prerequisite. Loudly, I want all of you to read. Patent fallopian tube is a prerequisite. If the fallopian tubes are blocked, IUI should not be done. IUI cannot be done. Is this understood to all of you? This ED matlab erectile dysfunction. Okay, so when the male partner says, sir, I cannot get erection at the time of sex, you said no problem, please bring the sample, we'll wash it, we'll push it inside the wife's uterus. Sir, count is 100 million, but penile deformity hai, no problem, get the semen sample, we'll push it inside the wife's uterus. Okay, so simple procedure. And main thing, egg, yes, egg is inside the body. That is IUI. Egg is still inside the body. Union. In anti-sperm antibody, yes. In anti-sperm in anti-sperm antibody, the sperms will get damaged. They will not move other way. They will get damaged only. They will get damaged by this anti-sperm antibody. They will become immotile. So they will attack, na? Because initially the sperm is in the vagina. They will not allow to go up only. Okay. In anti-sperm antibody, sperm will not move opposite, the sperm will become dead in the vagina, sperm will be killed. Sperm will be killed in the vagina, okay? Or will become dead, okay? Epispedias means, beta, when the urethral opening, a surgery teacher will show you, okay? Prerequisite matlab? That condition should be satisfied. That's the meaning of prerequisite, okay? Masood, एपिस्पीडियाज आपको बेटा सर्जरी में बताएंगे when the urethral opening is above or downward. So hypospedias, epispedias. Okay beta, that is the urethral opening is not at the tip of the penis. Okay, urethral opening is wrong, abnormal. Okay. Patent fallopian tube is a prerequisite. Prerequisite means it has to be present. But the patent fallopian tube is required. Prerequisite means it's a requirement. Okay, Dr. Bin, I didn't understand your question. Patent fallopian tube has to be required. मतलब मुझे आप लोगों से यही एक्सपेक्टेशन है कि अगर ट्यूब ब्लॉक है, डोंट मार्क IUI. Okay, now tell me, so what will I do if the tube is blocked? If the tube is blocked, all of you pay attention. If the tube is blocked, we can try to do a surgery. We can try to do a surgery to remove the block. Okay, कि sir अगर ऐसा कोई block है, we can try to remove the block. But sometimes the surgery is not possible and the tube is badly damaged. Very good. And the only option is IVF. In vitro fertilization. Okay, now in vitro fertilization, what we do, all of you pay attention. Again, all this nobody will ask you, but we give lot of injections to the female. Now see, IVF में क्या करते हैं, please pay attention. Okay, the tube is blocked, correct? The tube is blocked. Tube is blocked. तो tube कुछ काम का नहीं है, correct? ये tube block है, ये ट्यूब भी ब्लॉक है। तो अभी क्या करेंगे आईवीएफ में? ओके, आईवीएफ में क्या करेंगे सर? वी गिव लॉट ऑफ इंजेक्शंस टू फीमेल to produce multiple eggs. We give that HMG injection. Okay, so multiple follicles start growing, big follicle. Okay, so follicles start growing. Now when the follicle are ready, 18-20 millimeter, we go through the vagina and we suck out all the eggs out, isn't it? Because tube तो block है, तो जो भी ट्यूब का काम है वो डॉक्टर को करना है। सी ट्यूब इज नॉट वर्किंग। ट्यूब क्या करता है? एग को पिकअप करता है, तो वो मुझे करना पड़ेगा। आई विल हैव टू डू दैट। सो वी पिक अप द एग्स आउट, वी सक आउट द एग्स आउट। दिस इज कॉल्ड एज ओवम पिकअप और oocyte. All these details you don't have to remember. oocyte retrieval या ovum pick up मतलब eggs are picked up. Yes, multiple ovulation and all the eggs come outside the body in the petri dish. अभी समझ में आ गया? Yes, कि sir in IVF the eggs will come outside the body. Eggs will come outside the body. Now ध्यान से सुनो. On top of each egg, roughly I will put around 50,000 sperms. So 50,000, 1 lakh, 1.5 lakh, 2 lakh, 2.5 lakh, 3 lakh. So sir, even if suppose the sperm count is between 3 to 5 lakhs, our work is done. IUI के लिए कितना था सर? IUI के लिए minimum 5 million. Mathematics 1 million 10 lakhs. So 5 million मतलब 50 lakhs. तो अगर स्पर्म काउंट किसी का है 1 million, half a million, तो भी IVF हो जाएगा। समझ में आ गया कि सर if the count is 1 million, what will be required? 1 million count है, 1 million per ml. Yes, only 1 million count required. Very good. Yes sir, if 1 million भी है, 1 million मतलब 10 lakhs, half a million, 0.5 million. तो व्हाट इज आईवीएफ बच्चा लोग? क्या याद रखना है? खाली सिंपल एग ले लिया, स्पर्म ले लिया, प्रेगनेंसी बाहर बना दिया, एग एंड द स्पर्म टेकन आउटसाइड, एंड नाउ दिस एग एंड द स्पर्म इज द एम्ब्रियो. नाउ दिस होल 9 months the pregnancy can't go in and I put this in the incubator for 2-3 days. बराबर? एग लिया, स्पर्म लिया, प्रेगनेंसी बना के इंक्यूबेटर में डाल दिया. नाउ होल 9 months the baby can't grow in the incubator. Yes or no? Common sense. Okay, otherwise what will happen is the after 2-3 days I will take the embryo and I will transfer the embryo inside the uterus. This is called as ET, embryo transfer, and generally 2 to 3 embryo are put back inside the uterus. Is this understood to all of you? So common sense, all of you pay attention. कि imagine कि अगर पूरा pregnancy बाहर ही grow हो रहा है, full 9 months the baby is growing outside the uterus only. Very good. Then no delivery required. No delivery. Directly home delivery of the baby. After 9 months, madam, like Swiggy, Zomato, madam, today is your baby's birthday. We are delivering the baby hot, fresh and ready. So 9 months के बाद incubator खोलने का, baby को box में डालने का, Swiggy, Zomato का on the scooter, delivery, ting tong, happy birthday baby. Then I have to do आराम. As a gynecologist, as an obstetrician, I don't have to do anything. I just have to take the order. हाँ, इसका 9 months हो गया है, चलो Zomato का, Swiggy का निकलो, इसका delivery करके आओ, इसका delivery, Swiggy, Zomato का है delivering all the babies. Okay, so that is not going to happen. Then I don't have to do anything. Direct home delivery of the baby, happy birthday. Okay, so that is not going to happen. That is why बात समझ में आया कि we have to do this embryo transfer. That's the last step. Last step in IVF क्या है? That's why पूरा नाम है IVF ET. क्या है? इन विट्रो फर्टिलाइजेशन. नहीं बेटा, फ्यूचर में मतलब एटलीस्ट नेक्स्ट 100 साल में, 50 साल में तो नहीं होगा, उसके बाद होगा तो पता नहीं. यस, हो सकता है, यस, फ्यूचर में हो सकता है. करेक्ट. सो IVF ET, व्हाट इज दिस ET? एम्ब्रियो ट्रांसफर. Okay, and generally 2-3 embryos are transferred. So again, risk is more. Can anybody tell me what is the risk of this? अगर 2-3 embryos transfer किया तो क्या हो सकता है? Twins और multiple pregnancy हो सकता है. Okay, now please understand. Farah Khan, Om Shanti Om director. Correct? Farah Khan is IVF pregnancy. Farah Khan has triplets. Why? Because she's IVF pregnancy. Courtesy Jaslock Hospital, Mumbai. Okay? Farah Khan, Om Shanti Om. She makes always three letter ka movie. Main hu na. Om Shanti Om. Okay? Happy New Year to Farah Khan. Okay? Then Manyata Dutt, Sanjay Dutt's wife. Okay? Again, twins. Again, IVF. Okay, so this is only for your general knowledge and time pass. MCQ नहीं आएगा. Celebrities who have done IVFR 1, 2, 3, 4 all of the above. ऐसा question नहीं आएगा. Okay. Okay, so embryo transfer has to be done. So all these details they are not going to ask you, but just for your reference is that sir, when the tubes are completely blocked or the sperm count is less than 5 million per ml, but at least around 1 million. Okay, 1 million per ml. Okay, 0.5. Yes, higher chance of, very good, correct. Higher chance, 0.5 to 1 million. Okay, see, egg stimulation done with gonadotropin injection that I told you, HMG, or that recombinant FSH injection. Then the egg is picked up. Then the sperms are put on the in top of each egg. Embryos are kept in the incubator for 2-3 days, and after 2-3 days, the eggs are put inside the uterus. Generally 2-3, generally 3-4, and generally 2 to 3 embryos are transferred inside the uterine cavity. Okay, now the last thing, please understand, okay, when I put 2-3 eggs inside the uterus, it is not that always triplets. So when I put 3 eggs inside, one egg can get implanted only, one embryo, 2 reject, so single baby. 2 can get implanted. All the 3 can implanted triplets. All the 3 can also get rejected, and IVF can fail also. So please understand, it's not that if I transfer 2 embryos, always there'll be twins. If I transfer 3 embryos, always there'll be triplets. ऐसा नहीं है. ठीक है? The last thing, all of you, anybody, suppose the sperm count इससे भी कम है. Suppose the sperm count इससे भी कम है. मतलब के 5 sperm, 50 sperm, 100 sperm, तो क्या करना है? ओके, तो क्या करेंगे? तो IVF का बाप, IVF का मतलब के खाली 5 स्पर्म है, 100 स्पर्म है, तो क्या करेंगे? IVF का बाप इंट्रा साइटोप्लाज्मिक स्पर्म इंजेक्शन, ICSI. वर्जिन MCQ 2027 MCQ, ध्यान से सुनेंगे. Whole procedure is like IVF only. Whole procedure is like IVF. Like IVF, the eggs will come outside the body. 1, 2, 3, 4, 5, 6. Now in IVF, we put 50,000 sperms on top of each egg. Here, I don't have 50,000 sperms. I don't have means I have, patient does not have. So what will I do? Mechanically, I pick up one egg and I pick up one sperm, and mechanically, one sperm is put inside one egg. Okay. Yes. पकड़ के हम एग को फर्टिलाइज करेंगे, एंड बाकी प्रोसीजर सेम कि सर ये 8-10 एम्ब्रियो बना दिया और उसके बाद क्या करना है? अगेन पुट द एम्ब्रियो बैक इनसाइड द यूट्रस, व्हिच इज कॉल्ड एज एम्ब्रियो ट्रांसफर. Again 2-3 embryos, even one you can transfer, 1, 2, 3. So it is called as ICSI and मतलब in short embryo transfer तो करना ही है. Okay, is this understood to all of you? So whenever I say, whether I say IVF or I say ET, this is understood embryo transfer. Okay, this is understood. And ICSI के बाद भी embryo transfer. Okay, so please understand the steps are similar. You can read the steps are identical to IVF, but for fertilization step, one sperm is mechanically injected into one egg. Rest of the procedure similar, and you will then transfer the embryo inside the uterus. Okay, so this when I go for image based MCQ. Okay, so please understand, just to tell you a difference between IUI and IVF is this. Okay, this is the difference. Okay, sir, in IVF, egg is outside and we see so many sperms are put. So many sperms are put, any one of them will enter. And in ICSI, we can put a needle, you can see, and one sperm is put inside the oocyte. Okay, injection of a single sperm inside the egg. That is why intra cytoplasm. Is the difference between IVF ICSI understood to all of you? पूरा सेम है, स्टार्टिंग पार्ट एंडिंग पार्ट सेम है. Yes, the difference is only one line. Okay, sir, in IVF we are doing the nature will decide. एक ही एग है, उसके ऊपर स्पर्म डाल दिया, जिसका लक होगा दैट वन स्पर्म विल एंटर. इक्सी में आई एम ओनली चूजिंग द वन स्पर्म एंड पुटिंग इट इनसाइड. ऑल दिस नोबडी इज गोइंग टू आस्क यू. नो नो नो, देयर इज अ वेरी स्मॉल नीडल. बेटा इक्सी में क्या रिपीट करना है बेटा? इंट्रा वन एग इज टेकन. ओके, in ICSI one egg is taken, one sperm is taken, and under guidance one sperm is like this. All of you see over. Okay, is this clear beta? PK, ये देखो, ये है egg और the oocyte. ये है needle के अंदर होता है sperm. Okay, and directly we put, and this is the actual process. Please see this is the egg. Okay, and this is the needle, and inside this venus. Okay, so you can see over. Is it clear? When you see this side photo, it will be clear. Okay, so is this clear beta? PK clear हो गया? तो ये है egg cytoplasm, ये पूरा egg है, ये needle है. Can you see the sperm inside? One egg, one sperm. See, sperm is injected into the cytoplasm using a needle. बस, that's it. One egg, one sperm. तो उसको बोलते हैं इंट्रा cytoplasmic sperm injection. Okay, so nothing more than this can be asked in any of the exam. By the way, please understand, ये IUI IVF ICSI कोई ने किसी ने नहीं पूछा है. खाली now I want all of you to tell me the answers loudly. I am giving you three options. Your option number A is IUI, option number B is IVF, option number C is ICSI. Game शुरू होगा, last 2 minutes. Now tell me, which condition, what is the answer if I tell you that the female का fallopian tubes are normal and we have a male patient whose count is 10 million per ml. तो क्या चूज करेंगे तीन में से? ABC. 2027 next level MCQ. शमी बेटा BQ. Yes, फीमेल का फेलोपियन ट्यूब नॉर्मल है एंड 10 मिलियन है, तो IUI एब्सोल्युटली करेक्ट. ओके, yes, tube open, IUI plus count also, दोनों होना चाहिए. Now if I tell you count is only 3 million per ml, 2 to 3 million per ml count, what will we go for? 2 million, 3 million per ml count. क्या चूज करोगे? चलो next scenario. Yes sir, now we will go for IVF. Let the tube be open, no problem. Let the tube be blocked, no problem. And if I tell you that last point, if today the only patient, I have a patient who has got only 5 sperms, 5 sperm, 50 sperm, 100 sperm, that's it. तो क्या करोगे? बस 550 sperms, not million, 5 sperm, 50 sperm. तो क्या करोगे? यस सर, नो प्रॉब्लम. 5 एग भी मिलेगा, 5 एग मिल गया तो 5 स्पर्म एक एक उठा के अंदर डाल देंगे. एक से ठोको ताली, क्लैप. आई एम श्योर you, when you came today morning, you are not knowing all this, and now when you go back home, all of you have become expert. Okay, so this is the end of our session today. Thank you very much for coming in today. All thumbs up when you leave. Tell all the other students who have not joined today. I can see in the group only still around 150 students have joined in this Telegram. And yes, one more thing, dear student, I will put my YouTube channel. There are super videos. Please start following me on Insta. Every day I put out one MCQ for the day. So I will put my Instagram ka QR code on the Telegram channel. In this Telegram group, will also put my YouTube channel. All of you subscribe to the YouTube channel right away. Every day we are putting some beautiful videos, and you can go and check all the videos which are already present in the YouTube channel. And please, yeah, PDF I'm sending it. Okay, don't worry. PDF for today and tomorrow class I'm sending it. And I and all of you also start following me on Insta right away, because lots of interesting reels, lots of previous year question, lots of MCQs, lots of images I share on this also. No beta, break ke baad aaj class nahi hai, class is ending today. Every day my classes are in the morning, so all of you, I will see you tomorrow morning at 9:30 a.m. Okay, tomorrow we will discuss the topic of contraception and amenorrhea. We'll discuss all that. Yes, we'll share it now only in some time. Okay, give me some time, we'll share it. Okay, so tomorrow morning, all of you 9:30, and I will also send you the Insta and the YouTube in the group. And please, all of you start following, and tell all your friends and colleagues also who are not over here in this to follow me on Insta and YouTube. Okay, bye bye, best of luck, thank you very much.